couple of days later, it was rolled out. And I spent Saturday visiting some people downtown, young and old alike, and they were under the impression that we had made the decision already. And I think to ease the public, and I've already asked administration, people actually think that they'll end up in jail. And I don't know a bylaw in the country that a person can serve, and I'm not a lawyer, and maybe other people around the table are a lot smarter than me, but when us elected officials, and it wasn't us elected officials that put out the statement, start talking about jailing our residents, well, I would suspect that it causes quite a bit of angst, which it has. And the
point of order.
Okay, so I think we've got a point of order. I suspect the point of order is being called because all we're asking people right now is that they will go into this with a free and open mind. Yeah, I'm sorry.
Or if you have a comment. So I'll accept that point of order. Sorry, there was a lot of residents upset here in the last week or so, and sorry if I jumped the gun on that.
Okay, there will be lots of opportunity for debate. A lot of this evening. Councillor Murphy. Oh, sorry, my apologies, Councillor Maher.
Well, I find the request for this a little bit insulting because when we took office, we took an oath, and that hasn't changed. It's like I told my wife I love her once, and I don't need to tell her every day because if that changes, I'll tell her. So I'm going to say that I'm still recognizing my oath that I took when I took this office, and we'll have a very open mind on this subject. Thank you.
Councillor Murphy.
I don't know if I tell my husband I love him every day. Sometimes I need him. I usually backtrack. I'm going into this with a completely open mind, and I've read all the emails, talked to lots of residents, and I look forward to the debate.
Councillor Peddle.
I'm going into this with open mind, Mayor Scott. Thank you.
Councillor Stroud.
Thank you, Mayor Scott. Yes, I've read today's agenda and materials and will be listening to all the presentations made at today's meeting prior to making any decisions on this matter. Thank you.
Councillor Voisier.
Yes, I'm going in this with an open mind.
Okay, colleagues, so I think everyone's confirmed.
Sorry, Mayor Scott.
So with that...
Mayor Scott, it's Jade here. Sorry to interject. We do have Councillor Allen. He has just joined the meeting.
Oh, welcome, Councillor Allen. So we are just beginning item 3.1, which is the face covering bylaw. And I read out a statement just indicating that I was going into this with an open mind, and I was just giving everybody the opportunity to indicate if they wanted to say anything. And so I'll go to you for that as well. Do you have any comments?
Thank you, Your Worship. I just logged in, and I apologize to my colleagues for not being able to log in earlier. I just arrived at my destination, so. But I'm with Phil on this as well. I mean, this as with every other issue we've ever discussed, it is required under the Municipal Government Act, and I've always gone in with an open mind, and this is no different than any other. So. I've seen that there have been some comments that some of us already had our minds made up, and I take issue with that. And to me, that's no more than just another Facebook rumor. So, yes, Your Worship, I'm ready for the debate.
Okay, thanks very much for that. And so just to explain the process to everybody, so there is no bylaw that's been passed to date. This is the night when that is being debated and discussed, as has been mentioned. This bylaw is before Council for all three readings this evening. There is no debate at first reading, but registered delegations are permitted at second reading. Voting on consideration for third reading must be unanimous in order to proceed to third reading. I'm going to call upon Chris Davis to introduce the item.
Good evening, Your Worship and members of Council. I'm Chris Davis, Senior Manager, Legal Services presenting on behalf of Susan Trelinsky, the Director of Legal Services. You'll have before you, commencing at page 220 of the materials, our report, which I will review. First of all, the RMWB has seen a recent surge in the number of COVID-19 cases. This, along with the recent opening of schools, has prompted concerns that the rate of spread may continue to rapidly increase. There is substantial evidence indicating that the widespread use of face coverings among the public has a mitigating effect on the spread and severity of COVID-19. On September 8th, last week, Council passed the following resolution: that a special Council meeting be scheduled for Monday, September 14, 2020 at 4 p.m. to bring forward a mandatory mask bylaw for consideration at that meeting. Therefore, as a result, the administration recommends that Council enact the attached face covering bylaw number 20/024. As background to the bylaw, the provincial and federal governments recommend that the general public wear face coverings or non-medical masks while in crowded indoor areas where social distancing is not otherwise possible. Mandatory face covering bylaws have become widespread in other jurisdictions. First appearing in Ontario and Quebec in mid-June, these bylaws have since been adopted by several major municipalities, including Toronto, Ottawa, Calgary, and Edmonton, and also by many Alberta communities, including Grand Prairie, Red Deer, Lethbridge. COVID-19 is a present and continuing issue in the RMWB. As of Tuesday, September 8th, firstly, there were 66 active cases of COVID-19 in Fort McMurray and 2 active cases outside of the urban service area, totaling 68 active cases within the region. Of the 66 active cases in Fort McMurray, 40 of those were reported over the September long weekend, representing roughly a 2-fold increase in 3 days. Unfortunately, during the same period, 1 person in Fort McMurray passed away due to COVID-19. Currently, the government of Alberta has reported that there are 4 active outbreaks in the region. 1 at the Northern Lights Regional Health Center, or firstly. Also at the CNRL Albion. Thirdly, Suncor Base Plant, and finally, Syncrude Mildred Lake site. The status of the RMWB on the Government of Alberta's COVID-19 status relaunch map did change shortly after the long weekend, from the status of open to watch. Community status moves to watch when there are at least 10 active cases and more than 50 active cases per 100,000. Locally, Superstore, Rona, McDonald's, and Earls have each recently had to close to perform cleaning and disinfection protocols as a direct result of an employee testing positive for COVID-19. On September 8th, portions of the Suncor Community Leisure Center were temporarily closed for deep cleaning and sanitizing as a result of a confirmed case through contact tracing of COVID-19. In the RMWB, Syncrude, Walmart, Starbucks, and Superstore have implemented their own face covering requirements for employees and for customers entering their facilities. Fort McKay Métis Community Association, President Ron Quintel made a presentation at last Tuesday's council meeting confirming that face coverings are currently mandatory in that community. Finally, both Syncrude and Suncor are supportive of a mandatory face covering bylaw. What is the current understanding of face covering effectiveness? Firstly, as a physical mechanism, the current scientific consensus is that COVID-19 is primarily spread through small droplets of fluid produced by breathing, talking, or singing. Face coverings work by capturing the majority of these droplets, thus reducing the chance of infection. In early April, a study examining the breath of people with influenza and similar infections found that those who breathed through a surgical mask, that is a disposable mask, had significantly reduced or nearly eliminated the percentage of normal coronavirus particles in the breath. A more recent study examining the filtration effect of various materials against droplets equivalent to those exhaled while breathing found that while respirators, for example the N95 masks, were estimated to prevent 99% of predicted infections, even a non-traditional material, masks such as cotton, silk, or other common clothing materials, would still be able to prevent at least 44% of short-term infection events. What do regional studies advise us? The primary source of data regarding face coverings has been retrospective studies examining the spread and severity of COVID-19 through countries and locations with varying degrees of face covering usage. The consistent finding is that widespread face covering usage strongly correlates with a severe drop in the rate of spread. A forerunner of these studies published in April examined the per capita number of COVID-19 cases in 8 countries 100 days after the first confirmed infection. These numbers were compared with those of the Hong Kong administrative region, as the region bore a uniquely high rate of mask adoption at 96.6%. Hong Kong, despite being a highly dense urban region, had a mere 129 cases per million persons, compared with almost 3,000 per million in Spain, which had minimal face covering use at the time, and a little over 200 per million in South Korea, which began implementing mandatory face covering rules shortly after the first reported case. A similar study in the German city of Jena, near Leipzig, which adopted a mandatory face covering law 2 weeks before the surrounding state, compared the rate of increase between Jena and the surrounding area, and concluded that the masks reduced the rate of spread by 40 to 60%, Jena versus the surrounding state. Another U.S. study compared the rates of spread of 16 states which implemented public mandatory face covering laws between April 1 and May 21. The authors estimate that these mandates may have prevented between 250,000 and just under 500,000 COVID-19 infections during that period. What does decreased mortality come from the use of face masks? Recent thinking has emerged that face coverings not only reduce the spread but also the severity of COVID-19 cases. This idea is born from the fact that in jurisdictions and locations where face covering usage is widespread, the mortality rate is far lower than in regions going without. Research demonstrates that a person wearing a face covering has a better chance of developing a mild or asymptomatic case rather than a severe case. This explains why countries with high levels of face covering usage often have much lower rates of spread and mortality. What has been the trend of implementation in other jurisdictions? At least 17 municipalities in Alberta have enacted a mandatory face covering bylaw, which largely contain the following provisions. Firstly, a requirement to wear a face covering in an indoor public place. Next, they all seem to have exceptions to the general face covering requirement, which include some or more of the following. Children ranging in the age from 2 to 10 years of age, persons with a medical condition, disability, who otherwise cannot safely use or remove a mask, persons eating or drinking at an establishment traditionally offering food or beverage. Fourthly, persons engaged in a fitness or athletic activity. Fifthly, persons providing a caregiving service where wearing a mask would impair their ability to deliver that service. Sixthly, persons engaged in a service requiring temporary removal of a mask. And seventh, persons in an indoor area not accessible to the public or otherwise separated from the public by physical barriers, like a plexiglass shield. A requirement for businesses to put up signs is also typically part of a mask bylaw. And finally, some form of modest fine, something between $50 and $250 per incident, usually a penalty of $100 for a first offense and $200 for a subsequent offense. There has been experience in the city of Edmonton with attempting to provide an exemption provision or a card. That experience met with some difficulty, and that is not considered to be a viable option currently. Transit services in Toronto, Montreal, Edmonton, and Calgary found that mask compliance went up to approximately 90 to 97% following the issuance of a mandatory face covering bylaw. In Vancouver, the experience there was the transit service found there was very little need after passing a bylaw to enforce the bylaw. Though there have been some public protests against the use of face coverings in general, these have remained relatively minor. For example, there were protests against Edmonton's bylaw the day it was implemented, drawing roughly 50 people. There have been similar protests in Lethbridge and recently in Fort McMurray on the weekend and in Calgary as well. What is the rationale for this recommendation? We would conclude by saying that there is a robust body of evidence supporting the idea that widespread use of face coverings can reduce the spread of COVID-19. Requiring mandatory face coverings in the regional municipality of Wood Buffalo may help ensure the following: that there is a lowered rate of infection, that there is lowered severity of cases of COVID-19, that there are lowered rates of the spread of COVID-19, and that there are lowered rates of mortality. I would like to thank the Legal Services team for assisting in the presentation of this material following Council's motion of September 8th. We are recommending that Council, pursuant to Section 187 of the Municipal Government Act, consider that this bylaw be reviewed, debated, and considered for 3 readings. Thank you very much. I turn it over to the Mayor and Council for consideration.
Council members, it looks like we just lost Mayor Scott. I'll ask that you all just hang on 1 second as we try and reconnect him to the meeting.
Can you see me okay?
Hi, Mayor Scott, you're back?
I am indeed.
Great, thank you.
Okay. Yes, that's another example of what happens. So thank you for that. So next we're going to go to the motion. So we will be coming back to questions for administration as part of this process, and there's going to be lots of opportunity for those that have registered to speak. But first we're going to go to the motion. So the motions are just to put something on the floor so that everything else can happen. So Councillor Murphy, I'd invite you to make the motion.
Sorry, Mayor Scott. If I turn my video on at the same time, it keeps booting me out of the meeting right quick, too. So I move that bylaw number 20/024, being the face covering bylaw, be read a first time.
Okay, thank you for that. Councillor Peddle, I'd invite you to second the bylaw. Second the motion, sorry.
I second the motion, Mayor Scott.
Okay, so colleagues, with that, we are going to next move to delegates. So, Jade, could you describe the process that we're going to follow?
Hi, Your Worship. In accordance with our procedure bylaw, there are no delegates on first reading. Delegates will appear at second reading.
Okay, so with that, I'm going to ask the general question. Is there anyone opposed to this motion? So this is just simply putting it out there so that everything else can happen. Not hearing any response, that is carried unanimously, and we are now moving to second reading. So I'd call upon Councillor Peddle to make the motion.
Thank you, Mayor Scott. I move that bylaw number 20/024 024, the face covering bylaw, be read a second time.
Okay, and I call upon Councillor Stroud to second the motion.
Thank you, Mayor Scott. I second that motion.
Thank you for that. So that puts it on the floor. So now we are going to delegates. So Jade and Legislative Services, maybe you could just take a moment and describe how this process is going to work.
Thank you, Your Worship. We do have a number of registered delegates this evening. What we can do is, Your Worship, because I have an updated list, I can introduce them if you're okay with that, and then they can proceed for 5 minutes. I will start a timer here at my desk. When the timer goes off, I will notify the individual.
Okay, and we are going to limit everybody to 5 minutes. We think that's important because we want to make sure that everybody who's registered, and there are some that have registered by email, so we want to make sure that everybody's statement is given equal time. So it'll be limited to 5 minutes. So, Jade, please go through the list, and if there's a difficulty and you need my intervention, I will. Otherwise, we'll just assume that you're going to go from one delegate to the next and go through the list.
Great. Thank you, Your Worship. Our first delegate this evening is Denise Wilkinson. Denise, if you're with us, you may go ahead. You have 5 minutes to present.
Good evening, and thank you for the opportunity to share a community health perspective on the mandatory masking discussion. COVID-19 is a highly infectious, frequently fatal coronavirus. Alberta has recorded over 15,000 cases and over 250 deaths. There is no vaccine and there is no cure. Our best defence is prevention. The World Health Organization, the Centre for Disease Control, and Health Canada, along with provincial, territorial and regional health authorities, recommend a number of public health precautions to help slow the spread of this disease. Despite these efforts and regulations, asymptomatic carriers, our so-called super spreaders, are accounting for alarming increasing numbers of COVID-19 patients. From the beginning of this pandemic, masks have helped protect those working in direct contact with positive patients. Universal masking in healthcare settings has shown significant positive impact. When both the healthcare provider and the patient wear a mask, the rate of transmission is considerably reduced. In March 2020, the Czech Republic and Slovakia were amongst the earliest countries to flatten the curve, thanks to mandatory public masking and other common precautions. Unfortunately, lifting those restrictions in late August has resulted in a considerable spike of COVID-19 cases in both of those countries. The World Health Organization has issued guidelines on and support for public masking, specifically in combination with other universal preventative recommendations. Over 34 scientific papers indicate that basic masks can be effective in reducing viral transmission in public. Not one single paper shows evidence that they do not work. Over 100 academic leaders and Nobel Prize winners are calling for mandatory public masking. Today, over 130 countries have partial to full mandatory non-medical masking legally enforced, with results supporting those actions. I can continue to share scientific research and results from around the world, but this evening I'm here as a community-based Director of Health. I am proud to work in an Indigenous community with proactive leadership. Port Mackay First Nation, in very strong collaboration with Port Mackay Métis Nation, acted swiftly in March to help prevent and slow down the spread of COVID-19 amongst its members and the community. I believe one of the most effective steps leadership took was the mandatory masking. We do live in a region with a young population who tend to view young people as healthy and therefore at decreased risk of COVID-19. Well, we also have a young population with chronic illness, high-risk lifestyle, and high numbers of transient workers. Our young population is mobile, socialising, and potentially spreading a potentially fatal disease to our most vulnerable residents. Mandatory masking can prevent the spread of COVID-19. Prevention is the core of public health. Mandatory masking is a responsible thing to do for the public's health. Thank you.
Okay, thank you very much for the presentation. We're just going to run through the list. And colleagues, depending on how the first few go, we may just call out to see if anybody wants to ask questions. But Councillor Wilson.
Okay. Well, they just got it there, I guess. Thank you. I have no questions. Thank you so much for being here this evening.
Councillor Ingalls.
No questions. Thanks for the presentation.
Councillor Lamont.
No questions. You went ahead.
But just want to. Councillor McGrath.
Thank you. No questions at this time.
If everybody could please mute their phones, we're getting some exterior noise. We're not sure what that's from. Councillor McGrath or Mark?
No questions right now. I'm waiting for the rest of the presentation.
Councillor Murphy?
Sorry. No questions. Thanks for the presentation, Denise.
Councillor Tuttle?
No questions. We appreciate your presentation.
Councillor Stroud?
Thank you, Mayor Scott, and thank you, Denise, for your presentation.
Councillor Voisier?
No questions.
And I have no questions at all. One thing I can say is that we are all deeply grateful for all the presentations. We've received a lot of emails as well, but people who are willing to participate in the meeting itself, it's very helpful to us. So thank you very much for your presentation. What I'll do from now on, colleagues, is I'll just ask a question if anybody wants to ask the delegate a question rather than go through the list, and that may help things move along a bit. Okay, so
I'm sorry, Your Worship, I have a question.
Oh,
Councillor Allen, I have a question. Yeah.
Councillor Allen, I skipped you. Councillor Allen, fire your question away.
That's okay. Yeah, I'm kind of used to being called first, but no. And thank you for your presentation, Denise. It's good to hear your voice again. And I had to chime in anyhow, just because you may or may not be aware, I actually married Denise Wilkinson 6 weeks ago. But we've had this conversation before as well. I just have a question for you as a regional health person. As our chief medical officer for the province has stated previously, that about and you spoke to both the practitioners in the hospital and patients, and how it's been very positive results with wearing masks in that environment. But Dr. Hinshaw is on record as saying that masks on healthy people do not necessarily have the same effect. Do you have an opinion on that, or on the wearing of masks and especially things like cloth masks, with some of the suggestions that it's the moisture and other things that are being maintained in cloth masks? So as a health individual, do you have an opinion there?
I generally follow what is best practice online, but in healthcare settings, yes, we wear the surgical masks, because it is known that a healthy person wearing a mask, we don't know who's healthy. We have asymptomatic transmission of COVID-19. So if everybody has a mask, by me wearing a mask, I'm protecting you. By you not wearing a mask, I'm not being protected. So my just from my personal opinion, is if we could all wear masks, then we could all protect each other. With the cloth masks, I know they're two pieces of fabric as minimum. If they do get wet, you should change them. I mean, the evidence is out there for when you should change a mask, how often you should change it. There's also a survey that you can go on to Alberta Health Services where you can rank your risk of fatality from COVID-19, and it will advise you which mask you should wear. Somebody with a vulnerable condition, and, you know, that can be a 5-year-old child or a 90-year-old adult. Vulnerability isn't necessarily just linked to age. They would be advised to wear a medical mask, whereas somebody with no comorbidities would be advised to wear a homemade cloth mask. So it's all the evidence is there, and I'm happy to send any evidence if you would like to review it at any time.
Thank you very much. Over the last week, we've had a significant amount of evidence sent to us from various sources. So, and I think I have read that as well. But I just appreciate your response and for bringing your opinion forward today. And thank you, Denise.
Thank you.
Okay, thanks very much. Over to you, Jen.
Thank you, Your Worship.
Our next delegate.
Our next presenter is President Ron Quintel. Ron, if you're with us, you may go ahead. You have 5 minutes to present.
Thank you, Mayor and Council. I'll try to keep this as short as I can in terms of having 5 minutes available. But I guess what it comes down to here is, you know, over the last week since I first introduced this idea of mandatory masking, I've received, you know, a lot of hate mail. I've received a lot of complaints from residents of Fort McMurray and even within my own community and other, you know, Indigenous communities. But at the same time, there's an overarching support for it from many, many Indigenous communities and many people from within the city of Fort McMurray. The reason behind bringing this forward is if we're looking at overall health of our region and the unanimous decision by council earlier for us not to centralize our dispatch system out of Wood Buffalo. We did that to protect the residents of Wood Buffalo. We supported that, and council is going to support that motion because they want to protect the residents as much as they possibly can. A mask in a public area is doing that as well. It's about protecting everybody. You know, we look on social media, we see kids, you know, during lunch breaks without masks. That could be solved with a mandatory mask bylaw. We see kids going into restaurants without masks. That could be solved with a mandatory mask bylaw. This isn't a perfect situation. This isn't something that, you know, I'm bringing forward for the purposes of you know, offending or hurting anybody. I support everybody's right to protest, even those that decided to protest against this bylaw. I respect their opinion. But at the end of the day, I believe the best way to protect our residents, the science is there. You know, we have governments saying the science is there, and that is to mask up. And we need to do this, like I said, if our kids have to do it in school, then I think we need to do it as a public. We need to come together so that we can minimize the effect on this region at the end of the day. And, you know, for what it's worth, this is not about, you know, comments have come out that this is about me trying to further my political career. That's not what this is about. This is about taking care of my family. This is about taking care of my children. This is about taking care of my elders. There's nothing political about this. This is about saving lives. This is about minimizing exposure for the population that if they get exposed, you know, it could be disastrous for us. That's what this is about. You know, politicizing something that is so critical to the health of our region sucks. And I'll be the first to say it. But the only way that we can get this bylaw in place is by politicizing it before you, council, today to bring this motion forward for the protection of the rest of the region. And that's why I brought it forward in the first place. It works in Fort McKay. Every case that we've had 3 cases, and we've isolated those immediately, and we've been able to to trace those cases. We've been able to isolate and lock down the community in a way that helps. And it works. The proof is there. It works. So our residents have stepped up. They're doing it. I said last week when I spoke to council, you know what? In 1918, during the Spanish flu, you know what? Indigenous people didn't have any barriers to protect them. Now we're smart enough to get ahead of this thing so that we can ensure that we're going to make sure we live through this pandemic, obviously. But we also want to make sure that, you know, the rest of the region comes with us. Because if we're doing the work in our rural communities, which we are, the rural communities, in most communities, are mandatory mask. Why not in our city where a lot of these people get their services from? They get serviced in Fort McMurray, and if they bring that back to their community, then we have to work hard to isolate that. Where if we can make masks mandatory in public spaces in Fort McMurray, it's just an extra layer of protection is all I'm saying. I'm not taking away anybody's rights to breathe. I just want to ensure that I am protecting my children's rights to a safe future. Thank you.
Okay, colleagues, I'll just ask the general question. Is there anyone, and please just unmute yourself or otherwise indicate who would like to ask this delegate a question?
I just have an observation this year, Mayor.
Yes, please go ahead, Councillor.
I appreciate your concern, President Quintel. Appreciate your observations. And I know that since March, I think was lost on all of us, we've all been adhering to the CMO directions and considerations. And the mask has been part of that. If we can't separate 2 meters, then we have to wear a mask. And that's, you know, and I see a lot of responsible people doing that. And I'm looking forward to all the presentations tonight because I think we're lost upon this is already in place. And I think that we need to be conscious and mindful of the fact that there's some people that, you know, have challenges, which I've heard in the last week as well. So appreciate your observations, and I'm looking forward to the rest of the presentations this evening. But I'll just remind the public, I guess, and myself sometimes, that since the lockdown, the initial lockdown in March, that's what the CMO recommends across the province. And I've been in the communities that have mask bylaws, and I guess I'll save the rest for later, but I appreciate your presentation this evening.
Thank you, Councillor.
Okay, colleagues, I just want to double check. Is there anyone else who'd like to ask this delegate a question or make a comment? Please just unmute or just otherwise indicate. And I asked you this the other day, Ron. One of the points that was just made is the recommendation of the Chief Medical Officer, Dr. Hinshaw, that she did not mandate masks. And that's been pointed out to me a lot. And it's something I just like your views on. So we're taking it in this region one step further if this bylaw is accepted as is. Now, it could be altered or changed depending on what happens tonight. But do you have any views on that or any comments on that?
I do. There are no perfect answers here. And I think that this council voting tonight on something that is this critical, you know what, I'm happy I'm not you, to be very honest. But and I will say wholeheartedly, while they might not be mandated, I mean, it doesn't mean that it doesn't work. And you're seeing scientific evidence from around the world where masking works, where it minimizes. It's not foolproof. Nothing is foolproof at this point. All that we can do is take precautions as a society. And the how we draw those conclusions are drawn from scientific data that we get from our chief medical officer, that we get from the chief medical officer in Ottawa, that we get from the World Health Organization. That's all we can do is work within the scientific data that's being offered. And at this point in time, it shows that masks work. And I think that, you know, I'm not, you know, when I look at this, I wasn't supportive of schools reopening. I wasn't. I'll be very honest about that, because I feel that we're putting our children in danger. But you know what? Our children need to get an education, so we follow suit, and schools are making masks mandatory. So if our kids have to use these, why shouldn't the general public as well? If we're trying to protect our kids at this point, then why aren't we as a society, as adults, also protecting our kids by wearing masks in public places? Let's follow our children's example in this circumstance on how we can use scientific data, like what's coming out from numerous sources throughout the world and, here domestically, and implement that so that we as a society, as a region, can have just an extra layer of safety. And, like I said, it's not about taking away anybody's rights, and I understand that masks aren't mandated. I get that in Alberta, but there are municipalities that are. And those municipalities are seeing a trend in the opposite direction of those municipalities that don't. And from my perspective, I believe that, we need to take the scientific data for what it is. And, given the fact that our oil sands workers are having to go to work and go through the hurdles every day to be able just to go and earn a paycheck on these oil sand sites because we're trying to minimize that outbreak, we owe it to them as well. Because, if it's mandatory there, it's mandatory in our schools, it should be mandatory everywhere else. That's just my opinion.
Thanks for that. And one question that I'm probably going to ask all the delegates, or I'd like them to consider, is should this bylaw have an end date, or should it just, if it's passed, should there be a sunset clause? In other words, should it end at some point or some number of cases, or should it just be maintained until further notice or further action of council? And do you have any views on that, Ron?
Yeah, I think here in the community, when we put something in place, we revisit and we use data to be able to draw a conclusion in terms of moving up stages or down stages within the safety plan of the community. I would say that council continues to revisit this as time goes on. I mean, as information flows, the chief medical officer tomorrow could be announcing a new cure of some type. We don't know. So I think that's why we as a society or as a region, we need to keep our finger on the pulse of this. I don't want this to be a permanent bylaw by any means. I don't want to have to wear a mask any longer than I have to, but it's a sacrifice I'm prepared to make. But in this circumstance, at this point, from what we're hearing, we're months away from a vaccine. So I would say that, council can revisit the information and council be the ones who maintain the overall view on this in terms of what are the next steps and what is the sunset clause if there is one. But, at this point in time, it's just a matter of once the bylaw is in place, administration will be your best friends in terms of how you're going to guide this, because they'll be the ones gathering the information and they'll be the ones making recommendations. So I would say keep your finger on the pulse and allow your administration to do the job that they have been hired to do and keep us all safe.
Okay, colleagues, with that, I just want to open it back up again. Is there anyone else who'd like to ask a question of this delegate or make a comment? Okay, I'm not hearing anyone raise their voice, so we'll go back. Thank you very much, Ron, for your participation. We're deeply grateful for it.
Thank you, Mayor Council.
We'll go back to Jade, who has the comprehensive list.
Thank you, Your Worship. Our next speaker is Jean-Marc Guillemot. Jean-Marc, if you're with us, you may go ahead. You have 5 minutes to present. Jean-Marc, if you're with us, you may be muted. Please press *6 on your phone now. Jean-Marc, if you're with us, please go ahead. If you are muted, please press *6 now. Your Worship, I don't hear Jean-Marc connected at this point. What I'd suggest in this case is we move on to the next presenter. We'll come back to Jean-Marc and our team will reach out to him accordingly. Our next presenter is Megan.
If that happens.
Thank you, Your Worship.
Good.
Our next presenter is Megan McKay. Megan, if you're with us, you may go ahead. You have 5 minutes to present.
Hi there, can you hear me?
Yes, we can hear you. Thank you.
Good evening, councillors. There's countless reasons to not mandate masks for the people of Fort McMurray. But what I'd like to address is the elephant in the room, and that is the mental health crisis we're facing. And that's not due to COVID, but due to heavy-handed government lockdowns and public health measures. While not one child has died from the virus across our country, we're seeing an epidemic of suicide, and most disturbingly, child suicide and suicidal ideation. A recent report from Statistics Canada shows the leading cause of death in 10 to 14-year-olds since the pandemic began is now suicide. We've made life increasingly unbearable for our children. In many cases, children have been told they are vectors of disease and may harm their grandparents and loved ones by their mere existence. How stressful is this to put on to our children? Where is their mental health protection? Back in March, we didn't really know what we were facing, and the original COVID death model for our province stated 32,000 Albertans would likely die from the virus. As we sit here today, we've had 253 deaths in our province of 4 million people. The median age of COVID deaths in our province is 84 years old. The average life expectancy in Alberta is 83. The curve is flat. It has been for months. It's more than reasonable to say this virus has not turned out to be the threat we anticipated, with a survival rate of over 99.74% as per the CDC. Recent data shows that Canadians under 60 years of age have a 0.001% chance of dying from COVID. Instead of this coming as comforting news, we've experienced a continual bombardment from the government and media of how terrifyingly dangerous the virus is, droning on and on about cases, most of which are asymptomatic and mild in nature, people recovering. Instead of gathering in the streets to rejoice and embrace one another and carry on with life, we're now 7 months in, and we're here wasting our time and energy talking about a mask mandate that violates our most basic human right to breathe freely. People who are against this mandate are not anti-mask, but they're pro-choice, pro-liberty, and pro-personal responsibility. We don't like continually being divided in this manner. If people want to wear masks and believe it keeps them safe, that is absolutely their right. The government can take measures to protect the immunocompromised and elderly without devastating our mental health, economic prosperity, our rights, liberties, and freedoms. In a few short months, government handling of this virus has doubled our country's overall debt. Let's not forget that our children will be the ones saddled with this for the rest of their lives. What are the long-term implications of driving us into further economic despair? Furthermore, the United Nations estimates that an additional 130 million people will die of starvation by the end of 2020 because of the lockdown measures. This in itself should be enough to walk back all measures. Government intervention in our lives has been a complete failure. When people say it's just a mask or it's to protect others, they're failing to acknowledge the dire consequences these measures are having in our lives. Who's looking out for the lives and well-being of the people not vulnerable to the virus, the vast majority of Canadians? Is this really a fair trade-off? It's not just a mask. We're headed in the wrong direction completely. And as elected officials, all swore an oath to uphold our Charter of Rights and Freedoms, and to violate them, the onus is on you to perform your due diligence and present valid justification for stripping us of those rights. Given all the facts, it is clear that you haven't upheld that responsibility. I hear a lot of people talk about the cases. Well, if you truly want to take action to keep our community safe and strong, you'll drop this proposal and begin to take a hard look outside of the cases at the irreparable damage the government has already caused and work on reversing that. We are creative and we're resourceful enough to protect the vulnerable without it being at the expense of everyone else. We can't continue trading the lives, health, and prosperity of the majority to possibly save a few. This is not sustainable. We've been through a lot these past 6 years as a community, and I'm confident that we will make it through this as well by following facts and logic and taking into consideration the bigger picture.
Excuse me, Megan.
We'll have on our community now and in the future. Thank you for your time. I hope you'll take heart and time to reflect today and choose wisely. Thank you.
Okay, thank you very much for the presentation. So I'm anticipating there may be questions for you, so if you wouldn't mind remaining. And colleagues, is there anyone who'd like to ask a question of this delegate? I think I saw Councillor Murphy signal. Oh, sorry. I thought I saw you signaling. Is there anyone who'd like to ask a question of this delegate? Not hearing any voices raised. So I'm just going to ask a couple of questions. In your view, oh, sorry, did somebody else speak? Sorry, the challenges with technology are many. I just wanted to ask you, in your view, is there any threshold or any circumstances where you think masks could be mandatory? Like any number of cases or any? Have you considered that? And what would that be if there is a situation? Or is it
absolutely.
Just it should never be the case?
No, absolutely. Back in March when this all kicked off, like I said, no one knew what we're dealing with. But now we're seeing the numbers come out, and with the median death rate being 84 years old, and not a single Canadian child has died. It's clear who is at risk. And I mean, if everyone was dying and without multiple comorbidities and children were dying, and we all saw the videos of China, people dropping dead in the streets. Well, that hasn't come to fruition here. But it seems everyone is carrying on about cases, and it seems like everyone's out to lunch on the reality of the severity of this, but we're going down a really slippery slope here with all these measures, and we're digging ourselves into a hole with each passing week. It started with 15 days to slow the spread, and now it just feels like we're boiling the frog with all these measures. So absolutely, if people of all health statuses and ages were dropping dead, I would absolutely be for all of these measures, but they're not. I think at this point they're moot, and it's asinine to be introducing this 7 months into the pandemic. It's not even a pandemic anymore by World Health Organization criteria.
Okay, thanks for that. I want to make sure that I open it up again, though, to see if there's any other colleagues who have any questions or comments. Is there anybody who'd like to weigh in or have a comment?
Yeah, thank you, Mayor Scott. Through the chair, thanks for your presentation, ma'am. And I don't think there's anybody that's lost on the toll on mental health, especially in our community, whether it's COVID, floods, fire. And I certainly appreciate what you mentioned this evening, and more importantly, certainly the health of our teenagers and our young people are certainly front of mind, as is the rise in domestic violence and stuff like that. So thank you.
Thank you, sir. Thank you for your consideration, councillors.
Okay, colleagues, I didn't, unless there's somebody else who'd like to ask a question or make a comment, we'll go back to Jade. I'm not hearing any voices, so thank you again, Megan. We're deeply grateful for your participation this evening. And we'll move on to back to Jade.
Thank you, Your Worship. I believe we have Jean-Marc Guillemot now. Jean-Marc, you will have 5 minutes to present, and you may go ahead now.
I don't know. Can you hear me now?
Yes, we can hear you, Jean-Marc.
Oh, perfect. Great. Let me just... Good evening, Your Worship, and distinguished councillors and public at large. Tonight, I will be talking to you all as a worried citizen who, like you have been and are still going through some rather challenging times these last few years, compounded this year with, of course, the COVID-19 pandemic. In every well-ordered society charged with the duty of conserving the safety of its members and the rights of the individuals in respect of his or her liberty, this responsibility may at times, under the pressure of great dangers, be subjected to restraint and to be enforced by reasonable regulation as the safety of the general public may demand. The Center for Disease Control and numerous health officials have recommended wearing closed face covers or face masks to help prevent spread of the coronavirus. Some businesses have also followed this recommendation, requiring individuals to wear masks in order to enter the businesses. Masks are necessary because recent studies have shown that some individuals with coronavirus do not exhibit any symptoms, and even further, individuals who eventually exhibit symptoms can transmit the virus to other individuals before showing symptoms. While it seems to be a proven public health policy to protect everyone, some individuals refuse to wear masks. A similar situation arose during the 1918 influenza pandemic. In 1918, the city of San Francisco, California, enforced the wearing of masks to help slow down the pandemic. During this time, residents strongly opposed the mask ordinance, and eventually the mask ordinance was dropped. About a month later, the city saw an increase in cases and reinstated the mask mandate. Following the reinstatement of the mask mandate, an anti-mask league was formed to repeal the second mask mandate. San Francisco, unfortunately, had one of the highest death rates during this time. I am from this generation which witnessed the fierce debate over seat belts in all cars and on some public transportation. The 20th century saw a significant increase in deaths occurring in cars, which led to seat belts being required in all vehicles, but using the seat belt was not mandated. At the time, lots of drivers opposed mandatory seat belt laws. Some even went so far as to cut them out of their vehicles. These people made a choice to likely be splattered all over the windshields. Refusing to follow safety guidelines is not just limited to masks. Mandates requiring seat belts and face masks are totally different in asking people to wear masks in an effort to protect not just individuals but society at large. The argument against them is the same for both in my book. My wife has a very, very low immune system, compounded with other illnesses, and if by exposure find myself infected with COVID-19, I would likely put her life in a highly terminal status. That's a fact. Another fact which I wish to communicate to all, and as I understand, the legislation proposed with the imminent vaccine on a forcible horizon is not permanent. Wearing masks won't be the norm for the most mid to long-term future. With seatbelt in cars, trucks likely will continue to be. I will attach a certain timeline guaranteed or verbiage to that effect to give a sense of abnormality with current times of this proposed bylaw. We're all hopeful that this pandemic disappears and we can stop doing as much risk mitigation. But for now, we really depend on the trust and kindness of each other to protect our citizens. Are we willing to live in a selfish society or caring society? I know when I look at the news and see what's happening down south, my choice is clear, while being respectful of each other's liberties and choices between life and death. We all, not too long ago, and I understand for a lot of us it has been a while, but when we last took a flight, we buckle up. Steward and stewardess patrol the plane and ensure you will be taking off safely. I don't recall too many passengers standing up and protesting then. I think we should create a comparison poster that with 4 simple image panels. Seat belts before driving with a photo of a buckle and latch. Helmet before games with a photo of football helmet. Buckle up before taking off. And mask before going out with a photo of a mask. Simple. We can borrow some cues from the seatbelt debate to make masks more popular. We need to make them ubiquitous. First, if we want people to wear masks, we need to make them available. Seatbelts are built into every seat in a car now. If businesses and schools make masks readily available,
Excuse me, Jean-Marc.
people will be more inclined to use them.
Your time is up.
To go out of the way. Oh. Okay. Thank you.
Okay,
please pass this motion with proposed above friendly amendment. Thank you.
Okay, so we're going to go to questions of council or comments. Are there any colleagues who'd like to ask a question or make a comment?
Yeah, thank you, through the chair, Jean-Marc. In your knowledge, and you run a very big business here in the region. Are all your properties today request that as soon as the patron comes to your property, they mask up and mask down when they leave?
No, we do not. We cannot enforce it. What we have is an extensive posters all over our hotels. First at check-ins, every guest receives a bag with a mask, wipes, and sanitizer. In addition, they have extra sanitizers and masks in their rooms.
Right.
And all my staff have masks. Everybody have masks.
I appreciate that, and I guess what I was trying to ask is enforcement would be an issue, but I'm just wondering, as a business guide, like many have in the region already, many organizations have instilled their own mask policy. I'm just wondering if you're so adamant about the mask, how come you don't request your patrons to put one on when they come in and take one off when they go out, just like the Superstore or Walmart or, a lot of industry people. And there's other businesses around town, too, that request that.
It's a good comment, Councillor. I would have to take that with advisory from the team, but I do believe, certainly, because my hotels are in a public space, so I'm kind of in a bit of a bind between the fact that I understand, stores are in a sense a public space and that, but definitely the bylaw will encourage me to reinforce even a bit more.
Yeah. No, I'm not talking about an enforcement issue. I'm just talking about a policy that a lot of business owners and operators have instilled in their own people. So it's not an enforcement. I'm just wondering, as a business, because we heard from a lot of businesses in the last few days, there's nothing in place municipally or provincially or federally that stops you or your organization from requiring a mask in your premises.
No, understood. We will definitely look at taking a step further. Absolutely.
Thank you.
Okay, colleagues, is there anyone else who has a question or comment for this delegate? Okay, I'm not hearing any... Oh, sorry, go ahead.
I got my hand up. Thank you for your presentation, Jean-Marc. So from what I can understand, are you in favor of this bylaw?
Yes.
Okay, thank you.
With possible amendments to the fact of make sure that, and I think we just talked about that before, with a limitation somehow in the verbiage. And then I was trying to propose as well that maybe have a warning first and then have fines. but I'm able to start directly from fines right away. But I thought that maybe we'll do a warning first, and then we'll do fines. Just a suggestion. Thank you.
Okay, thank you for your suggestion, John and Mark.
Okay, colleagues, anyone else with a question or a comment for Jean-Marc? Just if people could just speak orally if there is anything. Okay, not seeing anyone else ask a question. I just had one comment. So if the bylaw is passed, there could be amendments, maybe not. Do you think there should be an end date to the bylaw or a review date? And if so, what's that duration look like in your mind? Or what should that be? Or should there be no end date? Should there just be until further action of council?
I think it should be some kind of parameter attached to it that, should the situation is under control, and I don't know how we will define that. I think that's where the health authorities could be more helpful to define us when we could have a green light to just, take this bylaw of the books there. So it has to be some kind of a thing that we define certain parameters. Yeah.
Okay, thanks very much. And I understand there's no other comments or questions from my colleagues. We're certainly grateful for your participation. And back to Legislative Services.
Thank you. Thank you, Your Worship. Our next presenter is Alexis House. Alexis, if you're with us, you may go ahead. You have 5 minutes.
Okay, hi. Yeah. Just a second, sorry. Okay, hi. My name is Alexis House. I'm 17. I'm a senior at the Coleman County Senior High School. And in 9 months, I will be eligible to vote. In 2019, I was recognized in YMM Parents' inaugural Top 20 Under 20 celebration. And I'd like to give a few words concerning why I'm in favor of passing the face covering bylaw. Now, on June 1st, 2020, a World Health Organization funded study confirmed that COVID-19 is spread person to person through close contact. It also confirmed that the use of face masks and coverings significantly decreased the rate at which COVID-19 was transmitted. I would also like to state that my father is a type 1 diabetic in his late 50s with an already poor immune system. I am not confident that he would be able to survive contracting COVID-19. For this reason, I am taking my senior classes online. Because of the recent jump in active cases in Fort McMurray, I am unable to do things I would normally be able to do if I were going to school. I can't go to after-school band. I can't see my friends every day. The longer COVID-19 lingers in Fort McMurray, the longer I will miss out on my last year of high school before university. I'd also like to acknowledge that COVID-19 is not deadly in every case, but neither is HIV/AIDS. And if I could do something that could prevent other people from getting HIV/AIDS, I would go out of my way to do that. And masks aren't fun. They're stifling, they're uncomfortable to wear for long periods of time, and they hinder our ability to communicate. But they are also scientifically proven to be effective. Masks work to protect others. Like herd immunity and vaccines, they are most effective when everyone is wearing one. And I can say with confidence that I would rather be a little bit uncomfortable, bear a little daily inconvenience, have my face a little greasy and my breath kind of smells kind of bad, than be the reason that someone's mother, someone's grandfather, daughter, or friend contracts COVID-19 and dies a preventable death. Enacting this mask policy lets me feel secure in knowing that a trip to the mall or to the grocery store or to a recreational facility is not going to cost my dad's life. At worst, I will wear a piece of fabric on my face in public buildings, and at best, I help ensure the safety of those around me and their loved ones. That's all I got. Thank you.
Thank you very much for participating. We're always deeply grateful for participation. So if you wouldn't mind waiting, there may be a question or a comment from colleagues. Colleagues, is there anyone who has a question or a comment for this delegate?
Thank you, Mayor Scott. I just want to thank the presenter. I know that just want to wish you the best, and I know that you're growing up in a generation that has never been saddled with so much uncertainty and challenges. And just your own story about having to stay home and, miss your friends and stuff like that. And that's all part and parcel of this. So really appreciate your observations and, certainly feel for the young kids, especially in our region, that have been through so much. And you're looking up to different levels of government to ensure the safety of not just yourself, but your family. And I think we all get that. And really appreciate you having the courage to come this evening at a young, tender age to explain your observations and your personal experience. So appreciate that, and I'm sure your dad appreciates you looking after him. God bless you.
Thank you so much.
Okay, colleagues, anyone else have a question or a comment for this delegate?
Thank you, Mayor Scott. I just want to thank the young presenter for her presentation and, her thoughts going forward. I appreciate all that you have taken under consideration in your presentation. Thank you again.
Thank you so much.
Okay, anyone else, colleagues?
Yeah, Mayor Scott, I just wanted to add thanks, Alexis, for presenting tonight. It's always good to hear from the youth in the community about all the issues that you guys are facing as well. Sometimes we forget at the Horseshoe that all the decisions that we make affect you guys just as much as everybody else in the community. And that's just because a lot of the time the youth are kind of intimidated and they don't come forward. So I really appreciate you doing it tonight. And thanks also for showing compassion to not just your dad, but to everybody in the community. Thanks.
Thank you.
Okay, well, thanks very much for that. Anyone else, colleagues?
Mayor Scott?
Okay, well, thanks very much for that. Anyone else, colleagues?
Mayor Scott, Councilor Marr here.
Yes, please go ahead.
Go ahead. Okay, thank you. Thank you so much. Having read over those emails, just having somebody with first of all, a youth with an open mind to all this certainly is a breath of fresh air. So thank you so much. I know we've got a lot to go through, but it's really refreshing when we hear somebody who brings perspective and certainly has an open mind to it. Thank you very much.
Thank you.
Well said.
Thank you.
Colleagues, anyone else? Okay, I'm not hearing any other voices raised, so I've just been asking people very similar questions depending on their position. So from your perspective, should there be an end date to this? So sometimes when bylaws are passed, they're passed for a certain duration, or they have what's called a review date, which means that they would be reviewed if cases hit a certain threshold, for example. So that's just an example of the many possibilities in any bylaw. Have you considered that, or have you thought about something like that?
I'd like to second what Mr. Quintal said earlier and have it perhaps under review by the council again when the time is more appropriate.
Okay. Okay, well, thank you very much. We're certainly deeply grateful for your participation. As my colleagues said, when youth participate, I think it means a lot to us. We know that our decisions impact you, and we're grateful for your participation. So thank you very much. So back to Legislative Services.
Thank you, Your Worship. Our next presenter is Melissa Blake. Melissa, if you're with us, you may go ahead. You have 5 minutes to present.
Thank you and good evening. You know you must deal with this issue, Council, as it really isn't going to go away anytime soon. You also know the provincial government isn't stepping in. You know that opinions and evidence are varied, and you know that masks are only one essential element to helping curb the virus. So too are hand washing and social distancing. Today, I'm asking that you cut through the aggressive resistance and know that enacting the bylaw is the right thing to do, though maybe not the popular thing. But Council, you've made bylaws that affect personal choice all the time. Think about the ones that require pets on leashes, or where you can build a shed on your property, and where you cannot smoke. This isn't any different, except that some glorious day, this may come to an end and that bylaw could be quickly repealed. So why do it? Because you have many citizens like me that honestly need the protection. You probably know some seniors or people who've had heart attacks, asthma, or cancer, but if not, then you know me, and you just heard from Alexis. Her dad and I are part of the folks who have type 1 diabetes in this region, and together we are some of the most immunocompromised people that COVID-19 could potentially have an effect and end our lives. We don't have the luxury of personal choice when it comes to protecting our health. You do, or you potentially die. That's how it is in our world. And if you're making everyone else wear a mask for our safety upsets people, well, I guess I'm sorry, but not as sorry as I would be if one of us lost our life because someone was an unknowing or carrier or super spreader, as they call them, who chose not to wear a mask. Please put opinions and arguments aside. I readily confirm that they are probably true. But so am I, and I need to be kept safe right along with the rest of the people and visitors to this region. You already strongly recommend that people wear masks when riding public transit. You keep people out of your meetings and use audio access like tonight instead. Our children are mandated to wear masks at school. Local businesses are mandating that their customers do too. Council, this is one way that you can help support local businesses who are bravely leading the way. You, Council, can be just as brave in leading the province. I ask you again to please support this bylaw tonight and to help make tomorrow safer for us all.
Well, thank you very much, and it's good to hear a familiar voice. And for those of you who may not realize it, of course, Melissa Blake was our previous mayor. So, colleagues, this is an opportunity to ask questions of Melissa Blake or make comments.
Thank you, Mayor Scott, and thank you, I guess I'll still call you Mayor Blake. Appreciate your presentation this evening and your sharing your sentiments and, the impact it could have on people's health. And I just had a question, I guess, and, not trying to put you on the spot. I'm just wondering, I know in March, the CMO is still today, wash your hands, cover your cough, don't touch your face, and where you can't be 2 meters apart, you have to wear a mask, and that's been going on since March. And over the last week, we've heard, since the news release, we've heard so much back and forth on the issue. It's a hot button issue, which that's why we're here. But I'm just wondering, an experienced person like yourself, do you think there's a reason why this is not federally mandated or provincially mandated?
I think that because of the contention that you're facing with the people who are strongly in favor and strongly opposed, that's not a territory other governments like to get into. They leave the dirty business to the local councils, and that's been seen time and time again. Councillor Ma remembered the non-smoking bylaw that we had to put in place. Other folks will remember when we had to debate things like those animal control bylaws and so on that I've talked about. But matters of health are very much in the provincial mandate. And so if we rely on what the Chief Medical Officer says, she represents the government in some respects, but she is not the ultimate decision maker. So the way that this evolution has occurred. Initially, we didn't have a big supply of masks, and we did have a lot of concern about how many cases there would be. And what we heard in the beginning is, well, masks aren't really that effective for people. Save them for the frontline workers and make sure that they're well covered when they're working with people who've potentially got the COVID virus spreading through them. So that was what we heard in the beginning. But what we've heard ever since is mounting evidence about how effective masks actually are. And those studies that were cited by the first presenter this evening, Denise Wilkinson, were some of the same ones that I've been reading. And I will tell you firsthand that the province has access to all of these things too, but they're still loath to tread into the territory that affects people where they live. And here we are. This is where we live, and this could be where people are not going to be living much longer if we don't get this virus to be actually stagnant. Right now, we've seen an increasing caseload. It's frightening to me because of my compromised health. And I'm just one. I can't imagine being a senior in this town and feeling that as they go out. They can wear their mask, and that's great for other people, but the other people not wearing them is not great for them.
Yeah, no, I appreciate, as always, Mayor Blake, sharing your observations, and certainly it's just another issue that, it kind of divides people, but doing what's right for people, I guess that's why we're here, and appreciate your insights. Thank you very much.
Okay, colleagues, I see Councillor Stroud has her hand up.
Thank you, Mayor Scott, and thank you, Mayor Blake, for your presentation. It's very nice to hear from you, and I'm so pleased in the way you articulated so eloquently why you believe this bylaw should proceed. Thank you again.
Okay, colleagues, is there anyone else who has a comment or a question to this delegate?
I'd just like to say thank you to Melissa for chiming in tonight. Certainly a perspective that some of us don't see. But as I'm moving on in years, that senior thing's starting to look a little closer as well. So thank you for bringing that forward. And it's always nice to say Madam Mayor again instead of Mr. Mayor. No offense, Norrie. Thanks, Melissa.
Colleagues, I understand Councillor Allen has his hand up as well.
I sure do, and you know what, Melissa, we still call him Madam Mayor every now and then too, just a slip of the tongue. Yeah, no, it's good to hear your viewpoint on this, and thank you for bringing that. Certainly, it's a viewpoint I've always respected. I just given your background and your experience, though, and this is probably a question you wouldn't be expecting, but I'm assuming you have read the bylaw. Do you have any comments on the wording of it? Because as you know as well, sometimes it's not necessarily the intent of a bylaw, but the actual written word in the bylaw that goes on about how it's enforced or how it's enacted. So I wondered if you had any comments on the actual technical document itself.
When I did go through it, the first thing I focused on is what were the exemptions. And reading through them, I was delighted that they did not repeat the mistakes that have been made in other communities where they created too loose a parameter for that. So I think we're in better position with what's included in the bylaw. And the second part that I would say is that with all the ones I've reviewed before, we've never actually put in the appendix what the fine structure looks like, and I think this one is quite appropriate. I've always been a big believer that you serve first to educate, then you warn, and then you enforce. This conversation certainly is helping with the education of whatever might happen, but you've got to undertake a lot more. So I loved in the bylaw that you've included the necessity of signage for people and businesses so that they would actually have it right front and center so people would know. And I don't think you could ask for more than that. For those who have commented to you about how frightened they are about going to jail and things like that, the bylaw appendix clearly states that that's not the outcome of what will happen, but we are serious enough to say that there will be a fine levied and an increasing fine for second offenses. So I think that you've done a really good job on the bylaw content.
Great. Well, thank you for providing that opinion as well. And thank you. It's good to hear your voice.
Colleagues, is there anyone else you'd like to weigh in or any comments or questions? Not hearing any other voices chime in. So I'll just ask you a few questions. Should there be an end date in your view? So you've heard me ask that of other people. So a sunset clause to end it or a review date in your view?
In fact, I said that it would be a glorious day when that comes, but we can't predict what that will be. And so trying to measure off against caseload is not an effective means of doing it. We have gone from very low caseload to much higher caseload right now. And even if we go back to the low, I want to make sure that we're not stepping beyond and creating another wave after this wave. So frankly, I think that it comes down to when we've got solutions in hand that mean we no longer need it. I've heard folks reference whether there was a, vaccine, that's the word. When they come up with a vaccine, if you say, oh, we've gotten a vaccine now, that's okay. But you've also got the time delay from the time you get the vaccine, it gets to our community, and then it gets implemented in the general population. So that's not the right trigger either. For me, I think you're going to have to find You can put a set date into it for review, but I wouldn't start to repeal it until you know you've got this well in hand.
Okay. One comment that's been made to me fairly strongly is that we are not medical folks. And essentially what the province has done is downloaded this decision onto us, as I think you've noted. And so you've got a bunch of politicians without medical training making a decision without the advice of medical people. And I think you may be aware of this and some others from comments I've made previously. The provincial government did, in fact, have a mask bylaw in 1918, way back in time. It didn't last very long, but there was a provincial mandated bylaw at one time. I'm just wondering if you have any views on whether do you think it's appropriate that we as a council make a decision given those circumstances?
I think you don't have a choice. Quite honestly, as I said in the very beginning, this isn't going to be going away anytime soon. What I do recall from previous bylaws like that non-smoking bylaw is that communities like ours was leading the way. Within a few years, the province had their own set of rules that applied, so now we all will follow what they put in place. But communities had to take the lead on that. The province was not going to do it, and I fear that the same outcome is happening here. So while you've got places like Edmonton, Calgary, and a number of other communities that have been identified, the more communities that are doing this, the more pressure that will put on the government to take their own act.
There's been concern expressed to us through emails, several of them, and other in-person contact that if we impose a mask bylaw as has been presented, this will have a negative effect on local businesses. And I know that you've served this community for a long time in various capacities. Do you have any views on that?
I think our local community...
I'm sure you've heard that.
I'm pretty sure our local community has been hurt so many times over that this is one more straw, and I think many of the camel's backs are breaking as we speak. But it's not because of masks, and it will never be because of masks. So we've got a number of other elements that are having influence over that. And for the folks that submitted in writing that they would no longer shop locally, my fear is that a lot of people are not complying with that ultimate goal to get as much business to happen in town as we possibly can. So the shift is not going to be as dramatic as they might be presenting. I think that it's already happened, and that's a bigger concern that you've got to address through other means rather than worrying about how the mask might have an influence on that. Businesses themselves have put in place the necessity for customers to wear masks because the effect on business of having to shut down and do extra cleaning, like the Rona example or the Earls example, the Superstore example, it's an awful lot of work if anybody comes into the establishment that has the COVID virus and it gets into the store. It just shuts their business down for days on end, and that's more detrimental.
Well, we certainly appreciate your long service to this community and your participation tonight, but I just want to open it up one more time to make sure that there's no further questions or comments from colleagues. Is there anything? Not hearing any feedback?
I would like to ask Melissa a question.
Sure, go ahead.
Yes, Melissa, through our history, there's never been a pandemic where
Sorry, I just want to stop for a second. I just want to make sure I understand who this is.
Sorry,
I'm having a hard time detecting. Oh, Megan McKay. This is just an opportunity for councillors to ask questions, not delegates. But,
okay. Thank you.
No problem. But thank you for that. I thought I didn't recognize the voice. I think administration's probably taking steps to make sure that doesn't happen again.
But, Megan, we do have an election next year.
Politics is my game.
Okay, one of the things I think we're learning as we do these meetings electronically is how difficult and how challenging they are. So I wanted to thank you again, Melissa, for your long service to the community and for your participation tonight. We're certainly grateful for it.
Thank you all.
Okay, thank you very much. Back to you, Jade.
Thank you, Your Worship. For anyone who has already spoken, I'd like to give you the opportunity to disconnect now, and we'll move on to the next set of delegates. Okay, our next delegate is Pamela Pittman. Pamela, if you're with us, you have 5 minutes to present.
Good evening, Mayor and Council. I have a few concerns regarding this proposed mandatory mask bylaw I'd like to address. First off, my biggest concern is with mask effectiveness and proper use. Most people, and especially children, are not using masks properly. They are constantly adjusting them and putting them on and taking them off, which inadvertently causes them to touch their face and mask, spreading even more germs onto them. Mask storage is also a big issue. When masks aren't being worn, where are they being put? Into a purse, in a pocket, thrown in a vehicle cup holder? All those scenarios are unsanitary for mask storage and lead to even more bacteria on the mask, which is then transferred to the mask wearer. Are the masks being washed after every use? Are they being washed properly? All of these variables can decrease the effectiveness of masks and can create further health concerns for mask wearers. My second concern is the inconsistency of when and where mask wearing is being enforced. My first example comes from elementary schools. The children are expected to wear masks in hallways and common areas indoors, and the older children even have to wear their masks in their classrooms. But then they all have recess outside at differing times with their cohorts, and mask wearing is not enforced. All the children are playing on the same playground equipment, and that equipment is not being cleaned or sanitized after each cohort. So how can we justify the children having to wear masks all day indoors when they are going outside for recess and using the same playground equipment mask-free? What about going to McDonald's Island or other sports activities? We'll be required to wear a mask walking into the building, but then are able to take off our masks to participate in physical activities? That totally contradicts itself. My third concern, if most cases in the region are linked to private social gatherings and workplace contacts, it makes no sense that we are making mask wearing mandatory in all public indoor spaces. Another concern is identification. It will be nearly impossible to identify criminals, and it also makes it much easier for a child abduction to take place. If no one can see your face, how can they possibly positively identify you? I sometimes can't even recognize people I know when they're wearing a mask. Penalties are another issue that needs to be addressed. Are we willing to waste valuable police resources to enforce this bylaw? It seems absurd that someone could spend as much time in prison for not wearing a mask as they would for committing more heinous crimes. My final concern is a deadline. Will there be an end date for this bylaw? Is there going to be a certain minimum number of cases that will decide if mask wearing is no longer necessary? I will not accept this as a new normal, and I do not want my children growing up in a world where bylaws and laws are passed based on fear rather than fact. Thank you, Council.
Okay, thank you very much. Now, if you wouldn't mind remaining until we get through the questions of councillors. Colleagues, is there anyone who'd like to ask this delegate a question or have a comment for this delegate? Yes, Councillor Lamont.
Thanks, Pam, for your presentation. I have some of the same questions, so they will get asked when we talk to administration later on.
Thank you, Councillor.
And that is a good point for everyone who's online or watching this, that there is going to be an opportunity for us to raise questions that are raised by delegates with administration. And that comes later after all the delegates have presented. then we can take those questions, and some of them will be related to administration for answers. So, colleagues, is there anyone else who'd like to ask a question or make a comment? Okay, I'm not seeing any other voices raised. So I'm just going to ask you a couple of quick questions, and you may have heard me ask other delegates. Now, you mentioned an end date. What would your view be on an end date if the bylaw is passed? I realize your position is against it, but what if there is an end date? What would that be, or a review date?
Well, I don't know if there'd be a definite date, but, you could set a date and then see where things are from there and adjust the date. But I just don't want this to be an indefinite thing. This is not a new normal. This is not the way life should be lived.
And is there a threshold or circumstance where you would agree with a mandatory mask bylaw? I realize your position's on the other side right now, but is there a number of cases or a circumstance when you think a mask bylaw would make sense? Or it doesn't matter, there is no threat?
Sorry, not necessarily a bylaw, but I'm not anti-mask at all. Like, there are situations where you should definitely be wearing a mask. Like, I have appointments with my sons at the stollery, I will definitely wear a mask. Or, if you need to go to the doctor's office for a checkup, yes, wear a mask, because there could be vulnerable people there. I understand that, but I don't think it needs to be mandatory. I think we're all responsible adults. We understand the circumstances, and we can make the choice for ourselves.
Okay, colleagues, I just want to open it up one more time. Are there any questions of colleagues?
Yes, Mr. Mayor, it's Bill.
Yes,
vulnerable people. Yes, please go ahead. Vulnerable people, as you said, you go to a doctor's office, you don't mind putting one on because there's vulnerable people there. But there's vulnerable people everywhere, isn't there? Maybe not as many, but
okay. So my stand is if the masks work like they say they do, and those people should be wearing masks. We shouldn't all have to wear a mask.
But sometimes we don't know who those people are. I don't mean to argue with you. I'm just saying, I look at people, if I don't know someone, I figure they might be carrying, or they could be infected. I don't know. We don't know, because the only people I kind of trust now are my cohort. That's family and at work. And even my family, sometimes I question where they've been during the day. So I don't know. It's just another measure. But go ahead.
You have children that go to school, because I can guarantee you that even if the kids are wearing masks, they're still sharing germs.
Yeah, I had 5 that went to school. They probably had germs every day. They're graduated now, moved on. But that's my daytime job is in education, and we realize that. But we're doing our best in what we understand. And you're absolutely right, ma'am. We don't understand everything there is to know about this virus. But to the best of our knowledge, and we're not doctors by any stretch of the imagination, to the best of our knowledge, these things do help. But over the last week and a half, I think it's been, or almost 2 weeks, I've been reading emails where people have come up with scientific research that they don't help. So that's what we're trying to get to tonight is, help us as politicians make a good decision here. And I thank you for your input.
Thank you.
Okay, colleagues, I just want to double check. Is there anyone else who'd like to ask this delegate a question or make a comment? Not seeing anyone raise their voice. So thank you very much for that. We're certainly deeply grateful for your participation this evening. And
thank you, Mayor.
Jade.
Thank you, Your Worship. Our next...
Can you hear us okay?
Yes. Thank you, Your Worship. Our next presenter is Richard Hack. Richard, if you're with us, you have 5 minutes. You may go ahead now.
I'm here. Can you hear me okay?
Yes, we can hear you. Thank you.
Thank you. My name is Richard Hack. I'm a resident of Fort McMurray, and I oppose this proposed bylaw. I will try to keep this short. I'd just like to present a few facts to the Council. Regarding the disease that we are confronting, Statistics Canada on August 28th released a report on provisional death counts up to June 2020. It states that, quote, most provinces and territories have had no clear evidence of excess mortality because of the COVID-19 pandemic, end quote. Regarding Alberta specifically, this same report states that deaths attributed to COVID-19 in the period of March through June, quote, have not led to a total number of weekly deaths beyond the range of what would have been expected if there was no pandemic, end quote. We've already heard tonight from another delegate that the average age of COVID-19 related fatalities in our conditions. The impact of this virus on our health has been relatively minimal, and certainly nothing like the Spanish flu of 1918, which killed many tens of millions of all ages around the world. As regards the science on mask effectiveness, a report by Alberta Health Services states the following, quote, there is a paucity of clinical evidence in favor of using medical masks in the community, with multiple randomized trials demonstrating mixed results, which when pooled demonstrated no significant reduction in acute respiratory infections, influenza-like illnesses, or laboratory-confirmed viral infections, end quote. On the topic of pre-symptomatic and asymptomatic transmission, this same report goes on to state that, quote, there is no direct evidence that the use of a medical or homemade cloth mask or the wider use of masks in the community significantly reduces this risk, end quote. And this is consistent with the guidance of the World Health Organization, which states, quote, there is no direct evidence on the effectiveness of universal masking of healthy people in the community to prevent infection with respiratory viruses, including COVID-19, end quote. However, that same World Health Organization report lists many potential harms associated with masks, including increased risk of self-contamination, headache, breathing difficulties, skin lesions and dermatitis, difficult communication, a false sense of security, improper mask disposal, and difficulty wearing the masks, especially for children, for deaf persons who rely on lip reading, for developmentally challenged persons, for the mentally ill, the elderly, those with asthma or chronic respiratory problems, those with facial trauma or recent facial surgery, and others. Finally, I am concerned about the psychological aspects of mask wearing. By covering our faces, we are isolated from other people, and a culture of fear is perpetuated in our community, a culture of fear which is not warranted by the numbers which are being presented to us by Statistics Canada. Our faces are who we are, our identity. We read emotions and nonverbal cues in the faces of others. Please don't take that away from us and from our children. I implore the Council to reject this bylaw, and I thank the Council and your worship for this opportunity to address you. Thank you.
Okay, and thank you very much for the presentation. If you wouldn't mind remaining, we may have some questions or comments for you. So, colleagues, is there any questions or comments for this delegate? Sorry, I just want to double...
Thank you, Mayor Scott.
Yeah, please go ahead.
Thank you, Mayor Scott, through the chair. And thank you, sir, for your presentation. And I believe I caught a glimpse. You still have some of your kids at home. You're not in support of the mask bylaw, but can I ask you a question?
Certainly.
You're probably like many other people. Have you been to a place where you took it upon yourself, being a responsible citizen, that you put your mask on before you went in?
Not in this town. I was in Edmonton, but it's different because they have a bylaw there. So I was wearing a mask there, but not here. No, sir.
So you don't feel there's a time, because since March we've been, recommended by the CMO and the federal CMO that we would actually, if we can't separate by 6 feet, we would wear a mask. And it seemed to be working fine until, some people jumped on making their own bylaws. And then, there's 365 municipalities in Alberta, and we have less than 2% that are signed up, and there's a reason for it. But what my question back to you is, do you think as you go forward, because the spikes were always going to be there with people coming back from all over the place and more stuff opening up, obviously it doesn't take a rocket science to figure out that we're going to have some increase in numbers as we open things up. 4 months ago, literally, we were all at home. So I'm just wondering, what would constitute you to feel you need to put on a mask? Where would you have to be?
I can't think of a situation, sir.
Okay, so and it's all I'm trying to do, sir, is educate myself. If you can't, let's say if you're on a work bus or a work pickup, would you wear the mask then?
Well, if it was mandated, then of course I would. But if it was not, then I wouldn't. Okay. And that's your personal choice, I guess, because I appreciate your presentation. I appreciate your honesty, and I look forward to when this all the delegations close, because I think we're in for a long night. I would, if I could just make one final point on that. There is some evidence when you read these reports from AHS or CDC, WHO. They all say the same thing. There's evidence from observational studies that masks may have some type of effect, but observational studies are not randomized controlled trials. It's considered indirect evidence. It's weak. It's prone to bias. That's not me talking. When you read the reports from these organizations, they say that. When you're looking for definitive evidence, direct evidence, you have to look at the randomized controlled trial. We have decades of such trials, and they all say the same thing. To quote again from the Alberta report, there is no clinical trial evidence that use of non-medical or medical masks in the community reduces viral transmission, end quote. And so that's why I answered the question as I did. If I'm mandated to because I need to collect a paycheck somehow, then of course I'm going to do it. But if it's not a mandate, I see the evidence just isn't there. And if this mask bylaw is passed, it will be done in spite of what these clinical trials are telling us, not because of it.
Well, I certainly appreciate that, sir. And just one more question, if I may, Mayor Scott. So, obviously, we all use the supply chain. And in that sense, I mean, like pick up your prescriptions or grocery shopping. If the business in our community, put a sign on the door and said, for our staff, for our municipality, for our customers, when you're on our premises, you have to wear a mask. Would you be okay with that?
I would look to shop elsewhere.
Okay. Well, I certainly appreciate the conversation, sir, and you taking the time to bring this out. Thank you.
Thank you, Councillor.
Okay, colleagues, I'm going to open it up again. Is there anyone else who has a question or comment?
Thank you, Mayor Scott, and to the presenter. I know that you've given us some information, but we've also received information, for example, from Dr. Hinshaw, publicly stated that public health advice is clear that masking is an important addition to Alberta's COVID-19 strategy. It's strongly recommended, and masks have been provided by the provincial government. We've also added mandatory masks to the province's return to school plan after reviewing new evidence about their effectiveness. I was just wondering what your opinion is on that.
I can't reconcile it, Councillor. If there is no clinical trial evidence that the use of any kind of mask reduces viral transmission in our community, I don't understand how those recommendations can be made. And I am not making this up. I can send links to anybody who is curious. AHS, WHO, CDC, they all say the same thing. There's decades worth of these trials.
Okay, I appreciate your information. Thank you.
Colleagues, is there any other feedback, comments, questions? If you could raise your voice. Not hearing any. If the bylaw is passed, I realize your position is that there should be no bylaw. Do you think it should have a review date or an end date?
Certainly.
I'm assuming that you would. And how long would you see that?
I think I read, Your Worship, I don't have this in front of me, but I think I remember reading that in Sweden they don't have mandated masks, but they review it, I think, every 2 weeks, which when you think about where we started, 15 days to flatten the curve, maybe that's not unreasonable. I would think certainly not more or certainly not less than monthly, because as other delegates have said, this is just not the way that life should be lived, and I don't think there's any justification for it. So certainly not less than monthly to review, I would suggest.
Okay. Well, thanks very much. We're certainly grateful for your participation, and we know it takes a lot of courage to participate in these meetings, so thank you very much.
Thank you, Your Worship.
Okay, back to you, Jade.
Thank you, Mr. Mayor. Our next presenters are Shelley Powell and Tracy Woosley. Shelley and Tracy, you have 5 minutes. You may go ahead now.
Thank you very much, Mayor and Council and listeners. It's Tracy Woolsey here. I'm with Suncor Energy, and with me is Shelley Powell, Senior Vice President, Suncor's Base Plant Operations. We truly appreciate the opportunity to address this topic tonight and appreciate the importance and variety of views on this topic. So Shelley's going to provide some remarks, and then we're available to answer some questions. Shelley, over to you.
Great, thank you, and thank you, Mayor and Council, for addressing a very difficult topic this evening. We believe this discussion is critical, as we're seeing a surge of new cases in the community, and we're very concerned. But we're also very confident that if we consistently practice safety measures such as social distancing, hand washing, and the use of personal protective equipment, including masks, that we can get through this. At Suncor, when we think about best practices in health and safety, we try to apply several layers of protection and several layers of redundancy to control risks. That way, if one of the layers breaks down, there are other layers in place to prevent unwanted events from happening. We believe a similar approach is also appropriate in addressing the risks of COVID-19. We believe that if we can implement a number of safety practices to combat the virus, we are at a lower risk of having the virus further impact our community and our operations. Within Suncor, our base plant facility has 11 cases, and we have been declared as an outbreak status. Comparatively, our fly-in, fly-out sites have 0 cases. With those 11 cases, the contact tracing has not identified any connections linking transmission to the workplace. Instead, it indicates the community is the common point where contact is occurring. With that, our concern is twofold. First and foremost, the health and safety of our community. And second, the impact that this may have on our operation. If one of our critical operational areas has a rash of COVID cases, then we may have to significantly alter our operations in that area. And this may also have an impact on other areas of our site, and thus our employees, our contractors, our service providers, and ultimately the community. This is clearly something that we wish to avoid. We have already seen impacts from COVID-19 on our industry and in the region. It has severely impacted commodity prices, driving them down. Already this year, we have had to reduce the number of projects and capital budget expenditures, and as a result, it has decreased the work of local contractors on our site, and it has had community impacts. If the cases remain high, we can expect to continue to see this type of negative domino effect. We are a region that is very integrated with industry. Any steps that we can collectively take as a community to mitigate COVID-19 are steps in the right direction. Last few months have not been easy, and we would really like to commend the Mayor and Council and everyone in our community, including all of our Suncor employees and contractors, who have worked so hard and have been so diligent. We need to continue to be diligent and careful. This is a very sensitive time given our children are going back to school, and we suspect that we will experience an increase in cases. This means now is the time for us to all be extra vigilant. Our ask is that the RMWD pass a mandatory mask bylaw to help us get through this critical time. The bylaw certainly doesn't have to be long-term, and of course, that is Council's decision. Other municipalities have put these bylaws in place, and the communities have adapted. Wood Buffalo has a deep commitment to safety, and if any community can adapt to a bylaw that helps our neighbours and our families stay safe, we know that Fort McMurray and the surrounding areas can. We thank you for your time and your consideration, and we know that this is a difficult decision. From our perspective, it's a critically important one at this time, and these small steps will make a big difference. Thank you very much for the opportunity to speak this evening, and we'd be happy to take any questions.
Okay, thank you very much. I anticipate there may be a few. So, colleagues, is there anyone who'd like to ask a question or make a comment?
Councillor Ingles here.
Yes.
My understanding, ladies, is you have a mask policy on your site at present. Is that correct?
Yes, that is correct.
Perhaps you could maybe help us out with some of the challenges you've observed going into that. Obviously, it's something that that added to the employees, and so it has to be enforced and everything else. And so we're confronting a similar, not same situation, because you make a best corporate decision you can, and for the well-being of your folks also. So I was wondering if you could maybe speak to some of the difficulties implementing it, and what you found as solutions to overcome those difficulties.
Sure. Thank you very much, Councillor, for that question. So as I mentioned, mandatory mask usage is part of a suite of protocols that we have in place, and in line with our view that multiple layers of protection is really kind of the best solution and approach, that no one thing is going to solve this and protect everyone. So we have physical distancing protocols in place, increased hygiene, cleaning stations, signage, increased or limits on room occupancy. So masks were also part of that suite. And, similar to, I suspect, the comments that you shared you're receiving over the course of the weekend, we similarly had feedback. We had a lot of individuals, expressing frustration. They're uncomfortable. They're tough to communicate in sometimes. And in each of those cases, what we had to do was go to those instances and understand, were there different approaches we can take? Was there different masks that could be used in some of those situations? But really just keeping the dialogue open and reviewing the different situations as they came forward. But it was not an easy implementation. Going right back to the implementation of all of our protocols, we've really had to work to reinforce and continue to communicate openly with our workforce and our contractors to get compliance to the levels that we think we need to protect our site.
And can you speak just briefly to how your employees have adjusted to that mandate and maybe perhaps to some of the adaptations that you've implemented to make that adjustment?
Sure. So I would say I've got the utmost respect and pride in the workforce and really the entire community of Fort McMurray. I think we've rallied through a lot over the last few years. It's been tough going on a number of fronts. So it's not an either or in my mind. It's really collectively how do we come together and do as much as we possibly can, even if it's not 100% compliance. If it's directionally in the right direction, it works to protect ourselves. So that's really what we've been focused on.
And my final question will be, do you feel that the acceptance level has risen to a point where it's becoming more of a norm and more acceptable and less difficult for your employees?
Yeah, absolutely. It becomes a habit. It just becomes a regular part of the personal protective equipment that we wear each and every day. And I would say as we've walked through additional protocols from where we started, which was let's wash our hands and hand sanitizer, and that seemed a little bit unusual if we think back to kind of where we were in March. But as we've gotten more comfortable, it becomes the norm, and compliance does naturally come into place, is what we found.
And finally, I just want to thank you for being candid and for giving us some insight into what you were confronting and how you confronted it. I appreciate that very much. Thank you.
Okay, colleagues, any other questions or comments for these delegates? Please just speak orally if there's... Yes, please go ahead.
Thanks, Shelley and Tracy, for the presentation. I was just wondering if you could touch maybe expand a bit about the operations and like what potentially could happen if COVID is in fact comes into the different departments for your operations specifically.
Sure. So maybe, Tracy, I'll start with you. You certainly feel free to jump in. I think it goes without saying that the last 6 months have been quite difficult for everyone. And, similar to that, it's difficult to predict what the next 6 months is going to look like, whether, there's going to be more waves, or there are going to be multiple waves. Is it going to come all at once? But certainly one of our biggest operational issues is just our ability to staff the facility and business continuity. It's tough to know where that ultimately goes if we have large portions of one particular part of our site that become ill and need to self-isolate. Then that takes them out of our workforce pool and population, regardless if they're asymptomatic, if they're recovering well. They're out of our workforce for that period of time while they are recovering. And what we do know in looking at other jurisdictions around the world that have had outbreaks that have gotten beyond the ability to staff plants, it has had some fairly significant impacts on production facilities all the way through to kind of full shutdown. So again, I'm not saying that's what's going to happen. We really can't predict, but that is our biggest fear of large community transition, that it does impact our ability to staff our facility.
And just out of curiosity, during this last week when you had the outbreak at Syncrude, was there a lot of costs incurred with that?
So I can't speak to the Syncrude experience, but certainly with ours, it does come with cost impacts. Even looking back at some of the actions that we had to take in March with shutting down a lot of large projects, we had a lot of job impacts on the contractor front. All of that has large costs associated with it as we have to start and stop work. That's not without expense.
Okay, thanks.
Okay, colleagues, anyone else have a question or comment for these delegates? Please just speak up if you do. Okay, I'm not hearing anyone comment. So you've heard me ask the question, I think, of some others, and I just wanted to put it to you. Do you think there should be a review date or an end date if the bylaw is passed? Or do you have any view on it?
Yeah, I think I would echo President Quintel's comments earlier about, let's use data in this case and assess where we are and make decisions. I certainly hope we're not wearing masks for years on end, but until we're through this, until we know that this virus is firmly in hand, whether or not that be through vaccination or other direction from our medical community, I do believe, and Suncor does believe, that this mask bylaw is an appropriate level of protection to add to the other protocols that we already have in place.
And I have a good sense of it, I think, already, but is it fair to say that if the COVID situation doesn't get under control or if it gets worse, then that is going to infect the employment of the people in this community from your perspective, or the livelihood of people in this community?
That's a really big economic question that's probably beyond a mass discussion, but it really does go back to the supply-demand economics of the energy industry that are kind of in play right now. We've seen COVID really impact the demand supply of that equation, and certainly other global aspects playing out on the supply side. But the energy industry is, certainly felt the impacts of this, and I think will continue to do so until the virus is fully under control.
No, I guess what I was getting at is, whether this community has a mask bylaw or not, contribute to your belief as to whether the employment opportunities for people in this community are going to be impacted, or the workforce of the people at your site are going to be impacted? I think I heard you say yes in your introduction. I just want to make sure I understood that.
Yeah, we do believe that it's the right thing to do. Like I said, if we have large outbreaks, we will move forward to take other steps that will look more similar to some of those more aggressive steps we took in March, where we shut down a number of projects, we halted a number of capital projects, really to significantly reduce the number of people that we have on our site. And those at the time came with job impacts. So if we do continue to see numbers increase and escalate beyond what we think is within our ability to manage, then those are some of the other options we'll be evaluating as well.
I believe you spoke to it, but I just want to see if and confirm that you believe the cases that you've identified, the majority of them have been community transmission. So it's not been out at site necessarily. Is that fair to say?
Yes, that is our belief.
Okay, and thanks for that. We're certainly deeply grateful for your presentation. I'm just going to ask the group one more time if there's any questions or comments from my council colleagues.
Just have one question, Mayor. Thank you. Through the chair, with the Atlantic bubble, when the folks that commute, and do most of them go back home and isolate for the 14 days that the Atlantic bubble requires, or do they come into the community and they stay into the community?
Tracy, I'm not familiar with that Atlantic bubble overlay or the requirements. I know when workforce returns to Newfoundland, I believe the protocols right now are self-isolation, or you are required to take a test. And I believe our workforce is doing that. But beyond that, I'm not overly familiar with the Atlantic province's protocols.
Yeah, and I know there was a time period, Councillor McGrath, when they strongly supported that. I'm not familiar what they're doing right now with it, but certainly a few, I'm going to say, month or so ago, that was in place, and our employees were required to do that.
No, I certainly appreciate your presentation, and I guess I know firsthand that there's been people that came and rather than going home, and I'd say home because I was born in the Atlantic, they don't go home now because if they go home, they have to isolate for 14 days, and if they have their family also has to isolate. So it's actually broken up a few families. So I think for this whole thing is having an effect on everybody, and I guess the more we could kind to work alongside with everybody to kind of keep the curve flattened, if you will. And I don't think it's any surprise that the numbers spiked in the last few weeks, simply because people are coming back, there's more stuff opening up, and I think that we just need to have to be diligent. And I think thanks to industry, we have a very responsible, safety-minded community. So I appreciate your presentation.
Thank you.
Okay, colleagues, any other questions or comments for these delegates? Thank you very much. We're deeply grateful for your participation this evening. So, colleagues, we had a request from a colleague for a break. So I'm just going to go to Jade. Can you just indicate how many more delegates we have, just so everyone's aware?
Thank you, Your Worship. We have remaining 6 delegates and 7 written submissions to be read aloud.
Okay, and then we'll be moving to questions of administration shortly after that. So, colleagues, what I propose is we take a 15-minute break, since we've had a break requested, and we'll resume at 9:05. Okay, everybody? So let's take a break until 9:05, and then we'll resume. Okay, colleagues, it's 9:05, and I'm just going to double check and see if Dave is on the line.
Thank you, Your Worship. I'm here.
If you wouldn't mind just doing another roll call, and then you can call the next delegate.
Thank you, Your Worship. Council members, when I say your name, please respond that you're still with us. Councillor Allen?
Yes, I'm still here for the time being.
Councillor Balsam?
I'm present.
Councillor Ingalls?
Ingalls here.
Councillor Lalonde?
I'm here.
Councillor McGrath? Councillor Marr?
I'm here.
Thank you. Councillor Murphy?
Yeah, I'm here.
Thanks. Councillor Peddle?
Present.
Councillor Stroud?
I'm here, Jay. Thank you.
Thank you. Councillor Voyageur? Councillor Voyageur, are you still with us? Mayor Scott, I see we have Councillor Voyageur still connected and Councillor McGrath.
Okay, we do have quorum regardless. Hopefully they'll reconnect here. Sometimes people have technical issues as we go through this. Why don't we just wait another minute and then please go ahead and proceed.
Thank you. Mayor Scott and council members, our next delegate is Christine Unruh. Christine, if you're with us, you may go ahead. You have 5 minutes to present.
Hi, thank you. I'm here. Can you hear me?
Yes, we can hear you. Thank you.
Hi, thank you. Thank you, Council, for taking my call. My name is Christine Unruh. I've already submitted my written concerns in regards to the use of masks and the proposed mandated use of them. I would like to take this opportunity to emphasize key points and concerns that pertain to the bylaw itself. For the record, I am opposed to a forced or mandated mask bylaw as previously written. The proposed bylaw indicates that children over the age of 2 will be required to wear a mask. In the K through 12 school re-entry guidelines, our province does not require any child in grades 3 or under to be masked. Our municipality creating a bylaw that supersedes this does not keep into consideration the importance of facial expressions, mouthing letters or words, interferes with vital communication at such a young age, which can interfere with their development. If this bylaw were to move forward, which again I do not support, I strongly suggest the mandatory age be revisited in consideration with both that many parents have difficulty convincing their toddler to even keep their gloves, hat, or shoes on, let alone a mask, and that it is unrealistic to expect that children at this age will be able to use, put on, or remove a mask in a hygienic manner, especially considering adults and older children alike are having difficulty with this. Designated eating and drinking areas will not only affect small businesses such as coffee shops and fast food, but busy parents and adults alike. Being a busy mom myself, I find myself eating on the run and having a coffee while running my errands. This will mean that for out and about errands or while watching your child in their extracurricular activities, parents will have to let their child go thirsty or hungry, inevitably also avoiding quick stops where you would normally purchase snack, tea, or coffee for yourself or your child.
Limiting where and when you can eat will also have a negative impact on diabetics and individuals who struggle with low blood sugar. Designated eating spaces in and of themselves, such as restaurants, are already at limited capacity as a result of COVID restrictions. Between this and the convenience of ordering online versus wearing a mask, there will be even greater turn to online shopping versus visiting and supporting local businesses. Requiring citizens to both wear a mask at work, at school, in their day-to-day activities will further encourage those who do not feel comfortable, safe, or healthy in a mask for extensive periods of time to avoid instead making extracurricular, lifestyle, and purchase choices that will not continue to negatively impact their overall well-being and mental health, perpetuating the isolation and stay-at-home mentality. The very intention that you as council members have to suggest to imprison someone for up to a year for not wearing a mask is completely out of line. According to my research on drug traffickers and thefts under $5,000, they are subject to the same time. Assault charges on summary conviction have a maximum of 18 months. These are extreme measures that you are proposing that have no place being in the bylaw, even as an empty threat. The bylaw, as proposed, also does not provide a timeline, expiry, or a trigger. Since eradicating a virus is not possible and slowing the spread is supposedly the intent, if your bylaw is considered, I press the council to include, shall we say, an on-off switch based on whether our local health system can handle cases that require professional care, as was the intent presented to Albertans from the beginning. As I understand it, and forgive me, I'm not a lawyer, according to the Alberta Basic Principles of Bylaws, you are required to advertise the proposed bylaw. Only after advertising the proposed bylaw, the electors may submit a petition to hold a vote to determine whether it should be passed. Do you as a council agree that you allow appropriate time and sufficient advertisement to the RMWB as a whole to meet its requirement of sufficient advertising and public inspection of the bylaw itself under subsection 606 of the Municipal Government Act? To this question, I then asked, at what exact date and time was the proposed bylaw itself advertised, and did it meet those advertising requirements? Please correct and acknowledge that statement. According to that same document, council cannot pass bylaws that affect individual rights. Now, this matter as to whether or not it actually does is open for debate, but I press the council to observe that Rocco Galati, an Ontario constitutional lawyer who in 2014 challenged Harper's appointment of a Supreme Court judge and won, is currently suing the governments of Canada, Ontario, and the City of Toronto for their pandemic response measures, including compulsory face masks, the closure of businesses, and the enforcement of physical distancing. While this is an ongoing case, I urge the RMWB to reconsider their proposed bylaw in the event Galati's case, and those like it, set a precedent for other municipalities to come under fire. With the rise of opposition to COVID restrictions and mandated mask use, I urge council to take caution, particularly with global protests on the rise. As you can see, many of your neighbors are not on board. Thank you for your time and considering my plea.
Thank you very much for the presentation. Some of the questions you asked, just so you know, we will be coming to questions of administration and relaying those questions. Several that you posed, I want to make sure are relayed. So they will be. But we're going to go through our colleagues to see if they have any questions for you and any comments for you. So colleagues, I would encourage you to ask any questions or to signal me that you'd like to ask a question at this time or make a comment. Is there anybody who'd like to ask a question or make a comment to this delegate?
Thank you, Mayor Scott. And to the presenter, I appreciate all the comments and your concerns that you have brought forward. And as Mayor Scott said, we will be presenting them to administration. Thank you.
Councillor McGrath. Oh, my mistake.
No, I'm sorry, Mayor Scott. I had no questions.
Okay, my apologies. Is there anyone else with a question or comment? I'm not seeing anyone indicate. So I'm just going to ask a couple. So you indicated about an end date. So if the law is passed, and you've heard me probably ask this of other delegates, what would you think would be an appropriate end date? And I realize your position is you don't believe it should be passed at all. But what would you think would be appropriate either as a review date or an end date or some sort of a threshold?
Well, I think that we have to remember what the intent was. The original intent was to ensure that our health system was not overloaded. And not at any time has our health system been overwhelmed. Of course, keeping in mind that you may pass this despite hundreds of pleas, I would perhaps suggest, instead of having to wait for it to go to council, that there's an auto-relax, just as we do with the winter maintenance zones, advertised when COVID cases are not risking overwhelming our health system.
Okay. And is there any threshold at all, and you've probably heard me ask this question, that you believe that mandatory masks would be appropriate?
I do, actually, on someone's personal property or business or their own home. It's their personal choice. If they want to post on their private property that they require me to wear a mask, and I can choose or not to choose whether or not to enter their property. This includes friends that might prefer me to wear a mask into their home. Now, that has never happened, but I would respect their own property just as I would hope that you would respect my property, my body. And then the other case, I have been forced to wear it for work, despite having in writing from my association in June that non-medical dust and homemade masks were not effective. And I risk not being able to provide for my son if I don't abide by those rules.
Now, just given your position, what do you make of the provincial position that mandates students to wear masks currently? And
what do I think of it?
Yeah. Just given your position that you're opposed to masks, and the province has obviously mandated masks for some people in this community already.
Well, I kind of touched on that in my letter, which council will read in future readings as well. But I, again, still think it should be free choice. I think that you are risking the health of healthy individuals. Again, there are conflicting and mixed information that we've heard from Hinshaw, Alberta Health Services, WHO, and CDC. So we could have a debate for months, which is happening over whether or not the masks are effective or not. But as a stance, I think it should be personal choice. And our children are low risk when it comes to this virus. That was, in my opinion, quite over-exaggerated.
Okay, colleagues, is there anyone else who would like to weigh in with a question or comment for this delegate? Not hearing any responses. So thank you very much for your participation. And
you're welcome.
You can go with the next delegate.
Thank you, Mr. Mayor. Our next delegate this evening is Elsa Gervin. Elsa, if you're with us, you have 5 minutes. You may proceed. Elsa, if you're with us, you may proceed. If you're muted, you may have to press *6 to unmute yourself. Mayor Scott, it appears as though Elsa Gervin's no longer with us. We'll move on to the next presenter, Clay. Clay, I won't try and pronounce your last name. You may go ahead. You have 5 minutes to present. Please introduce yourself for the record. Thank you.
Hello, Mayor and Council. Good evening. My name is Clayton Cuncio. Thanks for taking my call today. Can you guys hear me?
Yes, Clay, we can hear you. Thank you.
Okay, awesome. So yeah, I'm a concerned parent about, the effects of wearing masks. I'm not going to spend too much time speaking because Megan in the beginning and the fellow there was doing the quotes basically stole my thunder. My presentation was more in line with what they were saying. So I would just like to kind of just speak upon common sense. And when I listen to the individuals speak who are for the mask mandate, I hear, and it feels like it's a lot of feelings involved, personal interests where it affects their own personal bubble. But when I think about the greater human species and mankind in general, and I look at the statistics that a number of individuals have laid out on facts, who it's killing, the comorbidities involved, the age group, and I get rebuttal from people saying, I don't care about old people. And, again, it's a lot of feelings over facts. And for me, I care about everybody. All lives matter, whether you're young, old, middle-aged, health side effects or not. But I think the toll on mental health and, the economy and finding the next paycheck and the stress that it causes to all individuals with the fear-mongering that's going on. Science has told us in the past that the number one killer of people's immune system is fear and anxiety. And that is what we're putting our children through. I think of the young kids, from kindergarten to grade 4 that don't have to wear masks. And I know when I was a child, when I went to a school and there was grade 6, 7s, and 8s, it was terrifying enough to have to be in an environment of older kids, not to mention seeing my teacher now with a mask or a face shield and other older students, and thinking about the effects that has on, a child's future when it comes to having confidence and being in a safe place. School for me in a classroom, when you look at bullying, that's supposed to be your safe home. That's supposed to be where you can go and feel comfortable in your daily activities. And we're protruding fear amongst all these children everywhere. I think about, how kids are going to be in 10, 15 years. What's the connection to human society going to be like? And I get the fact that there are compromised people out there. My mother is a transplant recipient. She's on immune suppressant medication. I talk to other individuals that are older and unhealthy, and they would never, ever want to put themselves in front of ruining, a majority of other people's lives when it comes to physical activity. I've heard grandparents say, what's the point of even being around if I can't see my family? And I feel that masks are just a false sense of security based off the quote that the individual had spoken on earlier. It's giving people a false sense of security that they're safe when really they're not. When you think about touching surfaces, when you think about picking up an item off a shelf with your hands and then you scratch your face and you put the things back and, people coming by now picking that up. I mean, masks for me is a visual false sense of security that people are latching onto that aren't understanding the science and the data and the statistics that are coming out. And we need to educate people more because the narrative that the media is showing, the narrative that our health officials are saying are all negative. It's all bad. When in all reality, someone who understands the science, you can see that it's not as bad as what it is led to be. Now, in the beginning, when there were so many unknowns, 100%, let's take all measures that we can. In fact, we should have been wearing masks from March, and we should have had the lockdowns like we did. And as we're getting further into this, now we're putting in more measures. That should have been done in the beginning. And we're going in the opposite direction. Now the science is coming out. We need to use our common sense. We need to let cooler heads prevail. Anyone who knows human psychology is the best way to control and conform people is through fear, whether it's your supervisor threatening your job or your health. And so we have to put aside the feelings and the emotions, and we have to really start looking at the science and the data and using the best judgment as possible on the greater good of humankind and the mental health aspect of it, as well as physical health and the social interaction of our children and our families and our friends. You can protest in the streets in the thousands, but you can't go to your mother's funeral, in the beginning of this pandemic. So we need to really start to open our eyes. We really need to start looking at the science and not let fear of the media and fear of the officials steer us away from common sense and true statistics.
Excuse me, Clay, your time has concluded.
in closing, that's all I'd have to say. Please use your common sense on this.
Okay, thanks very much for the presentation. So, colleagues, is there any questions or comments for this delegate? Just raise your voice, colleagues, if there's anyone who'd like to speak.
Hi, Mayor Scott. I'd just like to make a few comments to Clay. Clay, are you aware that we've had 40 new cases over the long weekend, and it has put it from open to alert or watch?
Yes, I'm aware of the rises in cases, 100%. I don't think that's anything to be too alarmed about. If you think about at the beginning when we were executing 1,000 tests a day and we were getting 100 to 150 positives, and now we are testing up to, I think we broke a record, was it yesterday or today, where we're now tested up to 18,000 people. I think it's only natural to have a higher amount of case numbers when we're executing, 18 times more tests. So when we talk about flattening the curve and, the narrative of versus killing millions to not overwhelming our healthcare system, now it's, then it was flattening the curve, and now we're at its cases. So the goalposts keep shifting. We're not overwhelming our healthcare system. I think we're at 2.8% capacity. We have dedicated beds that are available to people that get infected. So I struggle to understand as to where the end goal is and truly what it is that we're trying to do. If our healthcare system was 80% overwhelmed or up to 90% capacity, we take action, but we're nowhere near those numbers. So we have all the strategies in place. We have all the beds available. I think that case numbers aren't as scary as what people are making it out to be. You're going to get more numbers with more tests. That only makes sense. And the only way we're going to get through this is eventually everyone getting it. I did the calculations. 160,000 people in Canada have been diagnosed with COVID-19 in 6 months. You multiply that by 2, so give it a year. That's 320,000 cases. You take 35 million people, divide it by 320,000, you're looking at it's going to take 116 years for us to get through this pandemic. So, we eventually have to figure this out, and we need to build herd immunity. And yes, I'm very aware of all the stats and the numbers, but you got to keep in mind the amount of cases or amount of tests we're now executing in a day.
And I heard that when you spoke that you had a concern about the masking at the schools.
Yeah, so again, it's just really for the children. That's their safe home. That's where they should be able to go and feel comfortable and safe. And, when I think of masks, it's scary. You don't get the, the number of people have mentioned, facial expressions, interactions, smiles, frowns. It's a scary situation when you're walking around seeing everyone wearing masks. And I can only imagine the parents that are so scared, and the kids having to hear this stuff. And it's just, it's terrible. It's unnecessary. And, and we have experts that are pushing these sorts of things. And I don't know, why don't they show the stats of suicides like someone mentioned? Domestic violence, alcoholism. Cancer kills how many millions of people a day, but nobody's screaming for a cure for cancer like we are for COVID-19 vaccine. But it's because it doesn't affect an individual's little bubble. But COVID affects everyone's bubble, so now they're concerned. I mean, starving children. The list goes on and on and on. And really, at the end of the day, this virus isn't killing anybody except for the elderly of 84 years of age average with 2 to 3 comorbidities. 70 and under is like a 1% chance of dying. So what is the panic? But the school part, it's the children. I mean, we've got to keep their mental health as our number one priority. They're our future, right?
Right. Okay, well, thank you, Clay, for your presentation and your comments.
And thank you guys for listening to me. I appreciate it.
Okay, hold on. We're just going to double check and see if anybody else wants to ask you a question or make a comment. And just so you know, we have no control over the schools. That's provincial. So you can talk to your MLAs or the provincial Minister of Health or Education about that. They're the ones that made that decision, not this council.
Oh, absolutely.
So, colleagues, is there anyone else who has a comment or a question for this delegate? Please speak up if there is. Not seeing anyone. You mentioned a threshold when you thought masks or action should be taken, but I just wanted to double check that. When do you think that should occur?
When wearing?
Yeah.
Sorry,
is there ever a time when you think they should be mandated?
Yes, 100%. So I think about, all the cases and who's getting affected from it and who's being affected. And we put all these measures in place provincially, and, we're still seeing a high number of elderly people passing away in old care homes and facilities and hospitals where they're really sick. So I think more focus needs to be put into where the problem is truly affecting the individual. So to answer your question, mask wearing should be 100% compliance when going into any old care home. It should be compliance going to any hospital, children's hospital, Stollery, anywhere where there's sickly people, cancer patients, cross-cancer, so on and so forth. That's where I would feel it would be appropriate. The rebuttal to that is there's those people walking around in public, but the rebuttal to that is that everyone needs to do their own risk management. We're all responsible adults. We know our own health conditions. We have to be able to manage our risk tolerance and change our risk behavior accordingly. So if it requires an elderly person or a sick person to get a family member to maybe do their grocery shopping, so be it. But we can't stop the world from turning because of the few that are compromised out there. For the greater good of humankind, we have to maintain some normalcy, and that starts with definitely not wearing masks in public.
Okay, well, I don't think any of my colleagues wanted to weigh in, but thank you very much for your participation. We're certainly deeply grateful for it.
I appreciate it, Mayor, and thank you.
All the best. Okay, next, back to Jade.
Thank you, Your Worship. Our next presenter is Sarah Lichty. Sarah, you have 5 minutes. You may present now.
Hello, can you hear me?
Yes, we can hear you. Thanks.
Okay. Hello. Thank you for giving me this opportunity today. I'm writing to you to express my concerns regarding the proposed mask bylaw. There is no scientific evidence that can accurately claim that masks reduce the transmission of the viruses. Countless medical professionals, scientists, professors, and experts advise against mask use. But for the sake of time, I would like to read a citation by Professor Dennis Rancourt and an open letter written by Chris Schaefer. Professor Dennis Rancourt, PhD and lead analyst on this topic at the Ontario Civil Liberties Association, states, in the many studies in which the known bias of self-reporting is eliminated by using laboratory-confirmed infection detection, no statistically meaningful advantage is ever found in either healthcare or community settings with either surgical masks or N95 respirators. No study, and there have been many, have been able to establish any advantage of wearing a mask or respirator with viral respiratory diseases. This means that, even in controlled professional healthcare settings, any benefit is too small to be detected by science, and other factors must be overwhelmingly more important. Regarding all viral respiratory diseases, which are both known to be transmitted by small aerosol particles, i.e. droplets, less than a few microns in diameter, and known to be highly infectious in terms of the so-called minimum infective dose, i.e. the number of virons that will likely be sufficient to cause illness or detectable infection. In plain language, this means masks don't work. A viron is a single virus unit, the RNA and its shell. Therefore, any societal debate about the virtue or responsibility of wearing a mask to reduce risk of infection is occurring in a science vacuum. It is a political and psychological debate, not one that is science-based. Moving on to an open letter written by Chris Schaefer. He wrote this to Dr. Hinshaw, to the physicians and public of Alberta. I have been teaching and conducting respirator fit testing for over 20 years and now currently form my company, SafeComm Training Services Incorporated. My clients include many government departments, our military, healthcare providers, and Alberta Health Services, educational institutions, and private industry. I'm a published author and a recognized authority on the subject. Filter respiratory masks, especially N95 surgical non-medical masks, provide negligible COVID-19 protection for the following reasons. Number one, viruses in the fluid envelopes that surround them can be very small, so small in fact that you would need an electron microscope to see them. The N95 masks filter 95% of particles with a diameter of 0.3 microns or larger. COVID-19 particles are 0.08 to 0.12 microns, which is much smaller than what the N95 can cover. Point number two, viruses don't just enter through our mouth and nose, but can also enter through our eyes and even the pores of our skin. The only effective barrier one can wear to protect against virus exposure would be a fully encapsulated hazmat suit with cuffs and ankles taped to boots and cuffs, by wrists taped to gloves, while receiving breathing air from self-contained breathing apparatuses. This barrier is standard gear to protect against a biohazard or a virus and would have to be worn in a possible virus hazard environment 24/7, and you wouldn't be able to remove it or any part of it, even to have a sip of water, eat, or use a washroom while in the virus environment. If you did, you would become exposed and would negate all of the prior precautions you have taken. Not only are N95 surgical non-medical masks useless as protection from COVID-19, but in addition, they also create very real risk and possible serious threats to a wearer's health for the following reasons. A, wearing these masks increase breathing resistance, making it more difficult to inhale and exhale. According to Alberta government regulations on respiratory mask use, anyone that is required to wear a respiratory mask should be screened to determine their ability to safely wear one. Any covering of the mouth and nose increases breathing resistance, whether the mask is certified or not. These individuals with pre-existing medical conditions of shortness of breath, lung disease, panic attacks, breathing difficulties, chest pain and exertion, cardiovascular disease, fainting spells, it goes on and on. They should all be pre-screened by a medical professional to be approved to safely wear one. Wearing these masks could cause a medical emergency for anyone with any of these conditions. It is dangerous to recommend, much less mandate, anyone with medical conditions to wear a mask without educating them about the risks involved in wearing them, without having been pre-screened and pre-approved by a medical professional first. B, in order for
Excuse me, Sarah, the 5 minutes has been concluded.
Okay, I will just summarize. When masks are properly fitted, they will not protect against virus exposure. However, they are capable of adequate protection from larger particles such as pat dander, pollen, and sawdust. That does not cover COVID-19 virus particles. So why the mask mandate? They don't work.
Okay, so we're going to go, please don't leave. We're going to see if any of my colleagues have any questions. Colleagues, any questions or comments?
Yes, I have a question. This is Bruce in Fort Chip.
Yes, please go ahead.
To the presenter, you gave a lot of information, to do with masks and including hazmat suits and everything else. I was just wondering, in your opinion, does a mask help prevent the spread from the individual that may have the virus from going outwards? Do you think that the mask doesn't do anything there, or is it helpful at all to prevent the spread from, say, a person that does have it, expectorating it further on into the public?
Yeah, okay, well, just because someone's wearing a mask doesn't mean that what they're breathing out and their viruses aren't being spread. Instead of it going just directly straight out, you still are going to have some viruses that will actually go through the mask, like I was suggesting. Plus, then you have all of the moisture going all the way around the sides, up and out and all around. It doesn't make you all of a sudden just not be able to transmit an infection or a virus. It's just you're not maybe seeing it directly. It's just being dissipated in a different direction than one you'd expect, but you're still contagious.
Okay, so you don't feel that they will spread, that they're reducing the spread further outwards. The masks are not doing that. That's your feeling. Is that correct?
No, the masks are not adequately protecting you from anything. If you're contagious, you're contagious. And
I'm not talking about the individual that is already contagious. I'm talking about potential people that may be within range of those virus. But thanks for your reply.
Okay,
Yeah,
colleagues,
that's
is there anyone else who has a question or comment for this delegate? Please just speak right up if you do. Okay, I'm not hearing anyone speak up. So I've asked a lot of the same question. I think I know the answer to this one, but from your perspective, based on your speech, but I just want to make sure I understand it. Is there any threshold or circumstance where you think masks should be mandatory at all?
Well, if they could magically come up with a mask that actually protected us, then maybe. But the masks that we're using now, even at N95, they're not providing adequate protection, so it's useless. That's like putting a glove on your hand to not get wet that just ends at your wrist, and then dunking your whole arm into water. You're still going to get water inside the glove.
Okay, colleagues, one last call. Is there anyone who has a question or comment for this delegate? Not hearing anyone reply. I just wanted to thank you again for your participation. We're certainly grateful for it. We know it's not easy to speak up at these meetings, but we certainly appreciate it. Thank you very much.
Thank you.
Okay, so back to you, Jade.
Thank you, Your Worship. Our next presenters, Alan Moore and Dr. Ahmed. If you're with us, you have 5 minutes to present. You may go ahead.
Thank you. Good evening, everyone. Thank you, Mayor and Council, for the opportunity to speak today. I'm Dr. Ahmed El-Mazougi, Syncrude's Chief Medical Officer and a member of the company's COVID response team. My wife, our 3 children, and myself are residents of McMurray. 2 of my kids go to schools here at McMurray. As mentioned, my colleague Alan Moore, our Manager of Government and Public Affairs, is also with me here this evening. I'd like to talk to you about why our company strongly supports a mandatory mask bylaw in public spaces across Wood Buffalo. As of today, Syncrude has had 28 workers test positive for COVID-19 related to the outbreak at our site. Thankfully, 13 of those cases have recovered and were cleared to return to work. Thus far, our investigations continue to indicate that the majority of these cases contracted COVID in the community. There's a smaller percentage that we are still investigating. We're not clear yet on what the linkage is. We do believe that having strong protocols in a public setting will only help protect all residents in the community, including our employees. Around the world, leaders and top medical officials all have struggled to find the balance between protecting citizens, keeping the economy going, and respecting individual choices. It has not been easy given how little was known about the coronavirus when Canada first experienced its case in early January. Throughout this, we've been guided by the safety and well-being of everyone on our site and our community neighbors. This is our most important value and drives all our decisions during these extraordinary times. Since the pandemic was declared in March, our company followed all the provincial and federal directives and followed the latest medical science to have measures to limit its spread and impact to our operation. This includes having a requirement on our sites for masks and other protocols such as physical distancing and hand washing and sanitization. Masks are among the many tools we have in our fight against COVID-19. Although it is not superior to physical distancing, as a medical professional who's part of Syncrude's COVID response team and have continuously studied the latest medical science, I know masks are one of the important barriers to protect people. When a person coughs or sneezes, the masks act as a barrier to reduce the chances of respiratory droplets from spreading to others or contaminating surfaces. We've done a lot on our sites to protect our workers, but those efforts can be bolstered by instituting improved measures in public. We know that in other communities, people simply needed a prompt to do something that they're already doing at work and in the schools, which is masks. We have seen in places such as Edmonton and Calgary, the number of people wearing masks change overnight when their bylaws were passed. In fact, there's a stark contrast in mask usage between McMurray and other communities, and that's concerning for us. Each of us needs to take personal accountability for our actions. And if we all do our part, we can continue to protect ourselves and our community. We've asked our employees to stand with us in our efforts. Now we're asking you to stand with us and to take every precaution to keep people safe. I urge you to vote in favor of this bylaw. I would now be happy to take any questions that you might have. Thank you.
Well, thanks very much. We're certainly grateful for your participation. So, colleagues, this is an opportunity to ask questions or make comments.
Yeah, I have Bruce again in Fort Chip. I have a question for the doctor.
Yes.
In your, you probably have a lot of exposure to many more qualified medical people than I ever would, or many of us would. So, in your associations with your colleagues and other medical professions, wherever you may encounter them, is there a percentage of them that would say masks are useless or have no value or are not a tool? And what would that percentage be, just roughly? I know it's a kind of a tough question to be asking, but is there very many that are of an opinion that they don't have much value?
I am still connected to my colleagues where I worked in emergency medicine in the Calgary area, general practice, my colleagues in occupational medicine that work for the industry and other different type of industries, a lot of specialists in the Edmonton and Calgary area, a lot of physician colleagues on the East Coast where I used to practice over 15, 16 years ago. And the common statement that we all would use consistently is if properly worn, if properly cared for, they do provide a benefit. It is not an absolute prevention. It does not prevent with an absolute certainty, but is certainly a tool. Once you add it to all the other measures that have been mentioned all throughout the evening, it will certainly reduce the risk. And that is what we're after. We're after reducing the risk as much as we can with simple measures and tools that when all combined together, the risk reduction will be significant. I cannot think of a colleague that I've spoken to over the past 6 months that said they would oppose or think that cloth masks or face covering of any type is harmful or does not provide protection.
That answers my second question I was going to ask. So thank you very much for that, Doctor. I appreciate that.
Okay, colleagues, is there anyone else who has a question or comment for this delegate? Please speak right up if you do. Okay, I guess I have a couple. So you've mentioned, we've heard a lot of what I would describe as conflicting medical information tonight. People are quoting studies and from studies, and I'm sure you've heard that as you've listened this evening. So, first of all, can you give us some sense of what is the latest medical information? And how do we understand all the other information that's being given to us? Are those older studies, or is that out-of-date studies, or is it just studies that are disputing the information that you're reading? How do you reconcile all these conflicting facts that are being put towards us?
Yeah, so there's no active studies that are specifically looking at COVID right now, and those studies have came up with their conclusions and final recommendations on the effectiveness or the failure rate of a mask versus the other. But knowing that COVID belongs to a family of viruses that we're very well acquainted with, the coronavirus family is not new to the medical community and to causing illnesses of any types. Yes, they're unique in terms of their implications and complications and the after effects, there is no doubt. And there's uniqueness also to every now and then of a health effect that is new that the rest of the family haven't caused in the past. So some of the data that's being quoted and the research is based on all data, whether from 2018 and all the way to 20 years ago and anywhere in between. I will try to explain one study that's being quoted frequently, that masks do actually cause more harm by causing more infection. That is based on a study where it was done on healthcare workers in a hospital setting who are in a high-risk situation, where they tried to see nurses and doctors in a certain healthcare facility where there's a lot of infections. By wearing a cloth mask, will they have more contamination and self-infecting themselves inadvertently? And the answer was yes. However, that was in a high-risk situation. That study is not relevant if you are not a healthcare worker, because we're talking about public use where we're not talking about sick people walking around. A recent, and I think it was quoted by the first delegate, talked about 15 or 16 states that mandated masks. That is a solid data that came out of the states where they've noticed that there was an incremental measurement of what is the reduction rate. And they've estimated that by mandating that the mask usage in those 15 or 16 states, they probably have reduced the number or growth rate by a certain percentage that would have equated to over 200,000 up to $45,000 cases. And that is a big number. And then you're looking at simulations, and it's not really a modeling, but it's very similar to a modeling where you simulate. So if we mandate masks, and we know the uptake will never, ever be 100%, so would 80% be reasonable? If it is reasonable, what would the benefit or the return on that mandate be? And at least they figured with that modeling that will be effective in reducing spread more than what a strict lockdown would do. So there is some simulations out there that looked at not only the effectiveness of masks, but the overall benefit of it versus a lockdown. And a lot of studies out there that will talk about, say, death rates as well. There's a study that looked across the world globally at the death rate in over 190 to almost 200 countries. And they found that the countries that favored mask use had much lower death rates. The last piece when we talk about, and it's always quoted, that masks do not help when we have healthy people. But remember Denise, when she talked earlier about the asymptomatic transmission, the pre-symptomatic transmission, now we know that is happening. We were not really fully aware of that happening early in the pandemic. That is where you're getting the best benefit. We're all walking around. I'm walking around healthy today. I mean, I could be an asymptomatic carrier who is going to get sick next week, or I could be a symptomatic person who haven't felt the real symptoms yet. I'm going to feel them tonight when I go home. So now if I'm wearing a mask this evening, I'm protecting people who are around me. So when we say healthy people, and that it's being quoted repeatedly by so many physicians, and including our own Dr. Dina Hinshaw early on in the pandemic, healthy people does not include asymptomatic carriers and does not include people who are in the pre-symptomatic phase.
Okay, thank you for that. So can you state, I'm sure you follow it closely, but with authority, what the latest statement by Dr. Hinshaw is, and on masks? And if masks are such a good idea, certainly this is a question that's been put to me, why has Dr. Hinshaw mandated it for Alberta? So I don't know if you can answer that, but just being in the same field, you might have a better sense of it than many of us.
Yeah. I can't answer why she did not go as far as mandating it or making a recommendation to mandate it. But I can speak to her most recent recommendations, and that's exactly what I was saying earlier. The mask versus no mask, we know mask will help reduce the transmission or the risk of transmission as long as they're worn properly and cared for properly. That is the key word, and that is one of the risks if the masks are mandated and there is no follow-up on how to care for them and how to use them. So I think her most recent message was around risk reduction and properly caring for them and when worn properly.
Okay, and I know you probably had a chance to look at the proposed bylaw, and do you have any comments on the bylaw itself from a medical perspective? Or are you satisfied that what you see there makes sense for this region?
I think where we spiked since the long weekend, I think it makes sense, absolute sense. And because when you're looking at so many cases popping and you're having clusters, if you have 10 cases that all of a sudden you had over one weekend, and those 10 cases are linked to one cluster with a full explanation of why we have 10 cases from a Friday and a Saturday and a Sunday, that wouldn't be alarming. But similarly, if you have 12 or 15 cases and 2 or 3 from a cluster here, 2 or 3 from another cluster, and 3 or 4 are unexplained, then you have so many unexplained small clusters where each on their own, if not very contained early on, that will really snowball really quick. So my comment is, I think we've saw the trigger in my opinion. I think if this is the trigger for the municipality to mandate this, there should be a similar metric that when it is up for review, I believe there should be a review date, that the same metric is looked at again, but again within a context. Are we worried about 5 cases from a known cluster that we know what the explanation is, whether a long-term care facility or a restaurant or one business or one gathering or one party? Or are we looking at 20 and explain? That will be more concerning. So when a review date comes to reassess on-off switch that was discussed earlier, a context has to follow that metric as well.
Mayor Scott, you're on mute.
My apologies. I see we do have another question. Thank you for your participation. Councillor Stroud.
Thank you, Mayor Scott. Hello, Doctor. Thank you for your presentation. Have you seen a rise in employees on medical leave since masks were implemented?
Councillor, is your question related to potential inadvertent effects from mask usage?
Yes, at your where you're working at the plant.
No, not our at St. Croix site, and I do oversee our illness and disability benefit program as well. I can say with confidence we did not have a single case.
Awesome. I don't know what you saw. Yeah. I don't know if it was good or not. Yeah. But, the overall practice, I killed it. Did you?
Well, yeah, we're getting some feedback from somewhere. If everybody could please mute themselves. And Doctor, we apologize for that. We're having lots of technical issues this evening. Sorry, back to you, Councillor Stroud.
Yeah. Well, thank you, Doctor. So what you explained to me is that you have not seen a rise in employees on medical leave since masks were implemented at St. Croix.
No, if it's your question is related to a potential adverse effect of wearing a mask, no, we did not.
Yes.
Mask usage have coincided with a lot of other things happening, but I understand your question. The answer is no. Yeah.
Okay, thank you.
Okay, colleagues, is there anyone else you'd like to weigh in or make a comment? Please just say so if you'd like to. Okay, Doctor, I just have a few more, and then we will let you go. We heard some comments earlier today about how the curve has been flattened, or that was the comment of some of the delegates. Is that your opinion? Has the curve been flattened?
I believe so. I believe we managed with all the good layers of controls and tools we put into place. According to the Alberta working group, there's an advisory group, medical professionals within Alberta, that worked a model predicting what might happen for the rest of 2020 and 2021. Health Canada have a similar model out there as well. A lot of Canadian experts, individual experts, have put modeling out there, and the prediction is we're going to continue to see these surges. We're going to see ups and downs. And with us rolling into the flu season, that will just going to be magnified. Yes, we will eventually sort out what's a true flu and what is really COVID, but we will continue to see these rises with an expected peak in the fall. I do not know if this peak this fall will overwhelm and kind of flip the curve, or would we be able to still weather this fall peak and still keep the curve flattened? I cannot comment on that, but I know we're going to have a peak in this fall, followed by dips and surges for the rest of this year and all the way through, I think, the spring of 2021. Would it be to the degree of overwhelming our healthcare system? The predictions is probably not, but not with a 100% certainty.
Okay, and can you share, if you have one, what your opinion is as to what the impact would be if we do not pass a bylaw? So if we have no bylaw, do you have a medical opinion as to what the likely result would be?
I'll use ourselves in crude where we are today. The numbers are available online, how many cases we have, and I just shared them earlier. We've had positive cases at our site. We truly believe with certainty that the majority of those contracted it in town. However, during their presence on our site, while symptomatic, they did not yield, for the most part, any positive cases. And I truly believe that is because of our mask policy at site. The opposite is not true. They've yielded so many positive cases in town through close contact scenarios, I believe, due to the lack of mask usage. Again, I'm talking most, not all, and that is in my opinion, that is a proof, although it speaks to only 2028 less than 30 number of cases. But if I am to use that as a trajectory and build on it from here, knowing that we're around the fall, things are going to be cold, people are going to punch up, smoke pits will be busier, restaurants are going to be busier, parties are going to happen more in the garage than the yard. I think we're going to see way more spread, and in the lack of extra barriers on top of what we already have, I see that trajectory being upward from here.
Okay, Doctor, I just want to take a moment and remind everybody, because we're still getting an echo and some feedback. If anybody has completed their delegation, if they've already spoken and they're a delegate, please disconnect from the line now and you can watch online. So I just want to make sure everybody is, after you speak as a delegate, that you're disconnecting. Okay, I'm just going to make one last call.
Donnie, I have a question for the doctor.
Yes, please go ahead.
Hi, Doc. It's Councillor Pomar here. How long does it take, I guess in your opinion, I'm asking your opinion as a medical doctor, how long does it take to properly study a disease that we didn't know about a year ago today? It's been with us now 7-8 months, I guess. Like, how long does it take to study a disease so we understand it completely?
It's a hard question to answer.
Well, I'll tell you why I asked, because, like I said, we've seen a number, and I'm not even going to put a number on it, of emails, both for and against this bylaw, and they're stating like a whole bunch of, facts, in their minds, it's facts about the research and this is the way it is, etc. Whereas in my background, talking to doctors and other people who have done studies, that you can't even scratch the surface in the first few years of a disease. You have to understand its behavior, etc. But yet we're being thrown all these facts, both one way and the other. What do we believe? What don't we believe? And with all the fake news on some of the channels now, it's really hard. And some of the evidence that I've read, they even said that it was based on a Facebook presentation. So what do we believe, Doc? That's the thing. What can we believe about the facts that medical people have discovered about this virus?
This is a very unique virus and has so many potential complications and implications and even effects on systems in the body that we never thought or seen before, like with other viruses that belong to the same family. There is recent studies that have just come out where the virus has effects on the cardiovascular system, where there are some odd cases here and there, people ending up with amputations and blood vessel disease in the neck and all that. But there are studies now that actually show on how that is happening, and we're only learning that 6-7 months into this, possibly 9 months if you want to count where it started in China. So you're right when you quoted years and years. It's going to take years before we understand the full effect of what it's doing to us. And I know there's some delegates who spoke earlier about the mental health impact of this, and that's not something to be taken lightly. There's going to be a mental health impact, maybe not because of the virus and how it is affecting us, but probably because of what we're trying to do to control it. And I agree with the delegates earlier who brought up all these points about the mental health impact of this. So there is cardiovascular impact. It's not fully understood yet, but there is more cases and more data being gathered. You saw that inflammatory syndrome being spoken about in children, and so on and so on. How long this is going to be around? I think we know what the answer is. It's just we don't have a timing on it yet. Once you have a vaccine, then you're able to build that immunity either through vaccine or through herd immunity. And herd immunity is a very well-known fact. Enough people get infected and become immune that the virus have nowhere else to go or bounce around. However, that comes with a cost.
Okay, any further questions, Councillor Marr?
No, I was muted by Jay. Sorry about that. I really appreciate the answer, Doc, and I think we know. I think we can safely say this is a very, very complicated issue, and no in particular person has all the answers. Thank you.
Thank you.
Okay, colleagues, another call. Does anybody have any questions or comments for this delegate? Please just speak up if you do. Okay, Doctor, we're certainly grateful for your participation, and you have a unique perspective that we certainly appreciate. But thank you very much for participating this evening.
Thank you.
And you can disconnect now. Okay, Jay, could you give us an update on how many more delegates are remaining to speak?
Thank you, Your Worship. We have one delegate remaining, and then we move into written submissions.
Okay. Please go ahead.
Thank you, Your Worship. Our final delegate this evening is Stella Lavallee from Willow Lake Métis. Stella, if you're with us, you have 5 minutes. Please proceed.
Yeah, hello, Mayor and Council. This won't be too long. A lot of things I wanted to say was said earlier today. I am Stella Lavallee, the president of the Willow Lake Métis Nation. Just to let you know, Willow Lake Métis leadership are in support of Bylaw 200024 and believe that we should all be wearing masks inside public places, public transport, and in businesses. It is now broadly understood that face coverings in public can significantly reduce the spread of this virus. Together, when paired with other public health measures, including washing your hands and practicing physical distancing, this can help prevent future waves of this infection. On a daily basis, Anzac experiences a high volume of out-of-town visitors. As we see the numbers of cases increase around us, and now the openings of our school, we believe that maintaining a vigilant approach to COVID safety within the RMWB will help support the well-being of the urban and the rural communities. So thank you for listening, and merci.
Okay, thank you very much for that. And colleagues, there's an opportunity to ask questions or make comments.
Hi, Mayor Scott. And this is to Stella. Appreciate you presenting tonight, Stella, as you are in my ward, and thank you.
Colleagues, anyone else have a comment or question? Okay, well, thank you very much. And I didn't have anything to add. I certainly appreciate all the delegates who are participating. Thank you so very much. And you can disconnect now. Okay, colleagues, so that brings us, I believe, to the written delegates. And Jade, can you just update us on how many there are?
Yes, Your Worship. So for written submissions received, intake 1, there are 23 written submissions. They begin on page 236 of your agenda package. Intake 2 has 79 written submissions. Those begin on page 274 of the public agenda package. Those will not be read aloud. We have additionally 7 written submissions that were received today prior to the start of the agenda item that we have to read for the record.
Okay, so please go right ahead, Jane, proceed.
Thank you, Your Worship. Good evening, councillors. I would like to add my voice to others voicing their concerns about a mask bylaw. It should be a personal choice to wear one or not, and the municipal council should not mandate something that AHS is not advocating for. Quote from AHS, while COVID-19 can be serious illness, many people have only mild symptoms. It appears the illness caused by COVID-19 tends to be less severe than some other coronaviruses, like the one that caused SARS. Did we need to wear a mask during the SARS pandemic? No. We are far from government projections made in the beginning of this pandemic to justify keeping the public in panic. If the municipality wants to force people by enforcing a bylaw and fining individuals for choosing the best path for their own health, mental, and physical well-being. Karen Savoy.
The next one we have is from Greg DeHaan. Hello, I'm writing to express that I do not support a face covering bylaw in our community. I understand that there is now also pressure from industry within the community, but I would remind the council that they are elected by their constituents, not industry. If the highest of medical officials of both our province and our nation are not pushing this directive, I do not believe it is the place for our or any municipal council to try and say they know better. There is no science to back up the efficacy of face coverings. I would ask council members that are considering supporting this to keep digging into it, and I would request that they look into the dispute between Ontario Nurses Association and Toronto Academic Health Science Network. Vaccinate or mask policy is illogical and makes no sense, and is the exact opposite of being reasonable. There are quotes from arbitrators' decisions, which is available in its entirety online. This is not a decision to be made by small business people of municipal councils. This is a decision to be made by Dr. Henshaw, Dr. Tam, and their counterparts. Like it or not, they have made the decision. Stick to municipal level politics, folks. You are punching above your weight class on this one. Greg DeHaan.
The next written submission is from Ismay O'Neill. Dear council members, please make mask use mandatory. It is impossible to remain 6 feet apart in almost all enclosed business headquarters, particularly from people who refuse to cooperate. I personally have to go into the post office frequently for work, and I have panic attacks before I go into the store each and every time now. It is impossible to social distance in there. I have to gently remind people not wearing masks to please keep their space from me each time, and it gets ugly quickly. My mental state should not be compromised weekly when I simply need to drop off a parcel for work. I also have a lot of relatives who live here who are older and who have underlying illnesses which puts them at high risk for COVID-19. I just want to see them safe and not afraid to go about their daily lives, running regular and unnecessary errands. Please help us.
The next submission we have is from Ty Andrus. I am a citizen living in Parsons Creek. I believe the mask use should be required in all public spaces until such time that COVID-19 pandemic is over. The mask argument is extremely simple, outside of the occasional cases of legitimate health issues preventing mask use. Wearing a mask is putting the community ahead of yourself and helping to protect others from contracting the virus if you're a carrier. Arguments against wearing masks are self-oriented and focused on individual liberty. This is a public health issue, and in the interest of public health, masks should be required in all public spaces. Thanks for your time.
The next written submission is from K.C. Hutchins. Dear Council, I am writing in today to express my opinion that wearing masks should be a personal choice. It has been brought into Edmonton, Calgary, Canmore, and Banff with their high tourist population for in public places, and still people choose not to wear them. The spread may be limited by the masks, but as we've seen in conflicting research, it's precautionary and not actually proven to not be hard on our lungs. Scientifically, we need to dispel carbon dioxide and sneeze, cough, particulates away from our body to not get sick. The mask would not only keep some CO2, but would also prevent our natural mechanism of ridding our body of particulates that could make us sick. The waste of disposable masks are becoming a litter problem around our city. It is currently mandatory for people to wear a mask to shop at Superstore grocery store, and still some people don't wear them. And in hard economic times, are we going to start fining people for not wearing them? I struggle to wear one because it's hard to breathe, and my kids are made to wear theirs at school even if they get headaches. I enjoy being on trails and going to the parks without masks. Just as an example, in Canmore, we did wear our mask to go into a building to dine, but then if we're all sitting and not wearing our masks to eat and drink in the same room 6 feet apart, but all breathing the same air in that building does not actually help, or is it just the easier thing to do? All the site workers have mandatory masks, and I have heard many people feel fatigued after 8 hours of wearing them. They struggle to breathe, and the moisture is also not good. At what point is this COVID-19 going to be gone? There is no unknown answer. What if research showed that many people may have already had this virus in November, December, January 2019, 2020, and we're just being careful? Regards, Casey Hutchins.
The next submission is from Wendy Lucas. To whom it may concern, I am writing to voice my opinion about wearing masks in public. I do not believe we should be made to wear masks, and I believe it is a personal choice to do so. Personally, I don't believe that masks help stop the spread of COVID. Many people don't even wear their mask correctly, causing more problems. I have seen so many masks and gloves on the ground around town. It is shameful. People are getting throat infections and lung infections from wearing masks all day long. Infections on their faces. Cloth masks are useless. Disposable masks say right on the box, do not prevent the spread of COVID-19 virus. People with medical problems and mental health issues have a very hard time with masks. My husband has a hard time breathing sometimes when it is just hot and humid, not alone with a mask on. And no, he doesn't smoke. He has a lung disease. Take a look at cancer deaths each year. Deaths from the flu, deaths from all other diseases Where is all the panic for them? Where are the numbers being posted? It is time to take a stand against the fear. I believe our body is our choice. The best for me is our children are in school, yet this town meeting is online because council won't sit together and the government won't sit together. How does this make any sense? A concerned citizen, Wendy.
The final written submission to be read aloud is from Sarah Doyle. To whom it may concern, my name is Sarah Doyle. I would like to speak to the mask bylaw. I am a person who cannot wear a mask. I have severe asthma. I put on the mask and can barely last a minute with it on. It triggers asthma attacks. I also have 2 autoimmune diseases, one of which is highly triggered by stress. Having to go shopping for my family and wear a mask is beyond stressful, especially when you cannot breathe for it. I cannot fathom the effects of having to go anywhere and having to wear a mask wherever that may be. Not only would I be unable to breathe, having asthma attacks, but I would also be suffering symptoms of Crohn's disease because of the stress of having to wear said mask. These things not only affect my life, but many other lives in our community. By making mandatory mask wearing a bylaw, it opens the door for those wearing a mask to attack people like me in the grocery stores and in any other place they are required. Grocery shopping for my children is a requirement. Please consider people like me when you vote. We need your support in being able to function in our community. Thank you. Mayor Scott, that concludes the written submissions to be read aloud. As I indicated previously for the record, intake 1, there are 23 submissions, all located on page 236 of the agenda package. Intake 2 includes 79 written submissions located on page 274.
Okay, so if my math is right, I think that equals 119 written submissions in total, just so everybody's aware. And anybody who wants to see those, they are in the council package. And I can say for all my colleagues, and probably several will mention it, we've received several, I would describe as several hundred emails in the last week. And I know several of those emails have ended up as written submissions. So, colleagues, we've reached the point now where we can propose possible amendments and questions of council to administration. So if there's anybody, we're reaching that hour. We have had kind of a running rule that we don't go past 10 o'clock, but it is now 10:20. So if we are prepared to continue on, then we will move to questions of council for administration, possible amendments. So is there anybody who would like to bring a motion to defer at this time? Otherwise, we're going to move to questions of administration. And for myself, I'm fine to carry on.
I will bring a motion to defer. Councillor Stroud.
Okay, and I think we would need so what you're saying is to move this item to a specific date, and when would that date and time be?
Well, it'll be Wednesday now. Wednesday at 4 o'clock, because we've got our own other council meeting on Tuesday.
Jade, can you give feedback on that?
Okay.
Thank you, Your Worship. Council has a meeting scheduled for tomorrow night, yes, and what we've been advertising to the public is that should council need to recess their meeting tomorrow evening at 10 o'clock, it will continue on beginning at 4 o'clock on Wednesday.
So I think what Jade is saying is there's already a meeting scheduled for 4 o'clock. It's the potential continuation of Tuesday's meeting.
Okay, well then I guess we'll have to go to Thursday.
Jade, can you say from an administrative perspective whether there's any concerns?
Thank you, Your Worship. For the record, our team does have a subdivision and development appeal board hearing scheduled for Thursday night at 6:30 p.m. However, if it's the will of council to proceed, we will make it work.
Okay, colleagues. I think the public want an answer on this. So let's go through the debate on this, on the deferral only. So I'll go through the list. So that's the motion before you. We would need a seconder. Is there a seconder for this motion?
I'll second it.
Okay, I think that was Councillor Lalonde. So colleagues, I'll just go through the list. So we're just debating and considering the deferral motion that's before us. Councillor Balson.
Personally, I'm okay to keep going, but I respect my colleagues and would be happy to defer it at least till tomorrow. I don't know if there's a way we can start earlier tomorrow and cover some of this tomorrow, or if there's options that my colleagues would consider. I know there was concerns about starting earlier than 4 o'clock for other meetings. So I understand the logistics of this. We have a heavy week. So I'm open to people's ideas. I just think we need to deal with this sooner rather than later, and I'll endeavor to make any time work.
Okay, colleagues, so as we go through the list, if you could speak to that, if Thursday works for you, if there's a sooner time, or if you have other ideas, if you're in favor of a deferral. Councillor Ingles?
Yes, I'm in favor of the deferral, and I'll adjust my timings to suit my council colleagues.
Councillor Lalonde?
Yep, I'm in favor of deferral as well, and I'll adjust the schedule as needed.
Okay, Councillor McGrath?
I support the amendment that's put forward for the meeting. Yes.
Okay, and Councillor Marr?
I'm good either way. I'm in Kelowna tonight, down here for my father-in-law's funeral. I've got nowhere to go. I can do it either way. Thanks.
Our condolences on that. Councillor Murphy?
Maybe if we could ask for some recommendations on when we would move it to. If Thursday doesn't work, and I think the agenda has to be published again within, is it 24 hours before that public meeting? So would potentially we even look at next Tuesday? I'm just looking for clarification.
Jade?
Thank you. Through the chair to Councillor Murphy, you're correct. Typically what we would do if we know in advance of a special council meeting for any date, we would still do our due diligence to publish the agenda for public transparency purposes on the Friday. However, under the MGA, the requirement is 24 hours notice to the public. We can waive that notice if all of council agrees to it in writing. So we could publish an agenda package in less than 24 hours notice if council members all in writing choose to waive the notice requirements. Does that help clarify your question?
Back to Councillor Murphy.
Yeah, that does. I'm just wondering what the consensus could be on that. But potentially, could we even do Friday night if we had that subdivision appeal? We're not part of that in any way, shape, or form on Thursday, but I know administration is.
Okay. And do you have a preference?
Tuesday better for everybody. I'm just trying to figure this out because I know the public wants to hear the debate as well, but I know that a lot of the members of the public are now having to work in that tomorrow too, and we're all kind of in the same boat.
Do you have a preference, Councillor Murphy, between Thursday and Tuesday?
No, but I do know that we have a heavy meeting tomorrow as well, and I still have a little bit of prep work for that as well. So, and you guys are all in the same boat. Huge decisions.
Sorry, Verna. Just to speak to your point there, procedurally, is there any reason why we can't just adjourn this meeting and carry it on, or add these items to the next agenda? You know, I know with other meetings we can adjourn and pick it up again. Is there procedurally a way to do that?
Good.
And like use carryover time from the meeting on Wednesday, or however that would work. I'm just wondering if that's a way around that, so we can get to this sooner.
Thank you for the question. Thanks for the question. Through the chair to Councillor Balsam, yes, procedurally, if council chooses to recess and defer these items over to tomorrow's meeting, you may choose to do that by resolution. What we would do at tomorrow's meeting, because the agenda has already been published, is at the adoption of the agenda, add this item to it.
Okay, back to Councillor Murphy. Any further comments?
My only concern with that is that I really want to give the residents that have been waiting for the flood mitigation / buyouts their fair meeting time tomorrow as well, because I know that that's probably going to be a huge 6-hour meeting, and we had already said that we would cut it off at 10 so that the residents knew that tomorrow night. So that would be my only concern. Like, I don't want to cut into their time either tomorrow.
Okay, Councillor Puddle, feedback?
I agree. Like, you know, I wish we could just continue tonight and get it over with, but I understand everybody's concerns. So I'm certainly good with my colleagues. I'd prefer to go on and get it over with, but I understand where everybody else is at also.
Councillor Stroud?
I made the motion for deferral, Mayor Scott.
Yeah. Any views on the various dates being proposed? I think we've heard Tuesday as well, and tomorrow night.
Yeah, I think Tuesday sounds good to me. It'll give more time for legislative services to advertise the meeting, and that might be the fairest way to go. Thank you.
Okay, and you made the motion, so I guess what we'll do is we'll, after we get through the list, we'll go back to Councillor Balsam, see if she wants to propose that as a friendly amendment, and then you can determine whether you'd accept it. Councillor Voisier?
I agree with the deferral.
Yeah, any suggestions as to date?
Doesn't matter.
Okay. And I'm like many others. I prefer to get it done tonight, but I recognize that not everybody's in that position, and that I do want the public to be able to see the debate. And it's probably going to go on for several hours, because first we're going to be asking questions of administration, which will take some time, and then there's going to be debate and then a decision. So this is not. It wouldn't end for a fair amount of time. So. Let's go back to Councillor Balsam. Do you want to suggest that as a friendly amendment?
Mayor Scott, I'm wondering, could we add it to the end of the agenda for the Tuesday agenda, the Tuesday-Wednesday agenda? And that way, at that point, we can decide where we are in timeline, how long those last. Maybe we're done earlier on Wednesday than we expect, and we can carry it into then, just as another option to consider. And then if not, we could adjourn that to another later time.
The only difficulty I think there is the public won't know when we're going to proceed with this. But that's another suggestion that's been made. So I'll go through the list again. So of all these suggestions, could people just weigh in on what they prefer? Councillor Engels?
Yes, the mention of the following Tuesday, if it's doable for everyone, it seems to be give us the best opportunity to give all of these matters our full attention. So I'm inclined to look at this following Tuesday to conclude the matter we're dealing with tonight, and we'll deal with the flood mitigation. We can focus on it and not. These are items we can't hurry through. So that's my preference.
My apologies. I've been skipping over Councillor Allen. Councillor Allen, do you want to weigh in?
Well, I'm kind of not that big a guy anyhow, so I'm used to that. I'm just, I'm certainly in favor of, you can call it a deferral, but I'd prefer to just call it a recess for the time being. My recommendation is to tag it at the end of the following agenda. I think they're both worthy of wholesome debate. And my time tomorrow is either intermittent or possibly not at all, but I'm scheduled for surgery first thing in the morning. So I would suggest that it's more important at this present time that we get this other one out of the way, because the folks with the flood mitigation to defer to the end of the next agenda. But I'm good with whatever happens during that debate, and we'll wait to see where we're at for time at that point.
Okay, Dave, if you could just keep track of the feedback, just so we can see where people are at. Councillor Lalonde.
I'm totally for the deferral, or recess, however, like Councillor Allen said. I don't think we should attach it to tomorrow's meeting or even Wednesday. It's not fair to the flood people who it's a big issue for the flood mitigation stuff. I think this one can be just moved to either Friday, Thursday, or Tuesday next week. And then we'll finish it Tuesday next week. Would make way more sense.
Councillor
and then maybe Dr.
Oh, my apologies,
No, then maybe Dr. Dina can, the province can send in some guidelines for us.
Councillor McGrath.
Thank you, Mayor Scott. I think a few people have their own few things to look after. So whenever the meeting is, if the good Lord gives me the health to be there, I'll be there. If not, I'm sure that's why there's 11 of us. I can only tell you that the next few days going ahead are questionable, but for sure I'll be here tomorrow. That's it. The good Lord don't have other plans.
Councillor Marr.
I think most of the issues we're dealing with this week are important, and I don't want to put one ahead of the other. If I have two jobs to do around home, I figure which one's going to affect my livelihood the most first. And really, this subject we're talking about tonight is very important. I mean, the one tomorrow night is very important, but they all have different ramifications. So it's almost like we're saying, we can do this one later. Let's do the flood mitigation tomorrow night because that's what everyone wants right now. I guess my question is there a timeline on the flood mitigation? I know we've said we're going to have the debate tomorrow night, but if we push that ahead a bit, is it going to make life or death difference? I don't know. Whereas this one, the mask bylaw, it could. I think it really could if we don't get on top and get going. And I'm not going to sit around and wait for somebody outside to make the decision or write the bylaw for us. There is a universal order to everything, and then I think life or death is probably trumps a few of the other ones. So again, I will go with the consensus of council, but that's just my feeling. And right now, I have the week. If I was at home, I would be really tied up with school. And matter of fact, I've been answering emails from that tonight while I'm doing this and listening. So I think that's what we have to answer is what's the priority here? What priority? We started this. Let's finish it, and then move on to the next. I think that's what the public expects. That's my feelings.
Councillor Murphy.
I don't think I really had further comments per se, but I don't know. I see where you're coming from, Phil, but I'm kind of, the expectation for that big meeting tomorrow. I don't know. I think that one should take priority. We haven't had this mask discussion for the last 7 months, and, we're holding our own right now. Our numbers went down a little bit today, but that's just my opinion.
Councillor Puddle, any view as to when?
I know the flood mitigation is important, and the residents are certainly looking forward to that. and getting that behind us. But I think the mask is crucial that we do this sooner rather than later. It does affect, employment of people, health and welfare of people, and us moving forward as a municipality. So for me, the sooner, the better for the masks. And again, I'll go with my colleagues, but this to me is a life and health and safety issue, so the sooner, the better.
Okay, Councillor Stroud.
Thank you, Mayor Scott. I tend to agree for Tuesday. The reason being is we're not sure how long the flood mitigation will take. It could take Wednesday and Thursday. Again, I feel that we can do proper advertising for the meeting on Tuesday. That's my opinion. Thank you.
Okay, colleagues, next we have Councillor Voiger, and then we do have a motion on the floor, so we're just going to proceed subject to Jade's advice. Councillor Voiger?
I'm game for whatever.
Okay. Jade, you were keeping track there, I think. Was there any consensus?
There was not. There's a mix. Honestly, it's almost half and half that are saying this one takes precedence over tomorrow, and then there's others that say just whenever. So I can't really offer up any consensus on this item from what I've heard through the discussions. One thing I would like to add for council's consideration is making a resolution to close delegates on this matter. We've heard from many delegates, and we've received a lot of written submissions. And I just want to make sure that public transparency-wise, people understand you've heard your delegates and you've received written submissions on the matter.
And would that be appropriate to do after the motion that's on the floor now, or would you prefer that be withdrawn and then we deal with the delegate issue first?
You can deal with it after the deferral.
Okay.
Can I interject?
Yep. Sorry, go ahead, Councillor.
Mayor Scott, Councillor Maher made a very compelling statement there, and I agree with him on that, that I would like to just deal with this matter and finish it, complete it, and then move to the next where we can give it our full attention. So that's my position.
Okay, and Jade, we've already got an agenda for tomorrow. Maybe you could describe what the options would be there if we were to adjourn this to tomorrow, which I think is what Councillor Maher might have been suggesting. What are the options?
Council members, if you choose to defer this item to go to tomorrow's regular council meeting, what I would recommend is that in your deferral motion, you identify at which place in the meeting this item is to be dealt with, whether it's at the beginning of the agenda or at the end of the agenda for public transparency purposes. Following that, should the motion pass, we will work with our communications team to advise the public accordingly.
Okay, colleagues, so we've gone through the list. I'd just prefer to get this done as soon as possible. I think it's obviously an emergency. Pandemics that's the nature of a pandemic. And we need to get it dealt with as soon as possible. So that's my feedback. I'm flexible. I can do it anytime, but sooner rather than later. But we do have a motion on the floor. Councillor Stroud, you've heard the various suggestions. If anybody wants to make a friendly amendment to Councillor Stroud, they're welcome to do so. Councillor Stroud may accept it, may not.
Mayor Scott?
Yes.
It's Krista. Councillor Stroud, if you're willing, and if we are looking at moving it to tomorrow, I'd like to suggest we defer to add this to the end of the agenda or before the agenda, but I would recommend we start earlier tomorrow, especially as we've had all of the public delegates that are for this agenda item. If my colleagues are willing to start at, say, 1 or 2 o'clock, that might allow us to get through this before the 4 o'clock start time or close to the 4 o'clock start time for the flood matter, if we were to move this to the top of the agenda for tomorrow.
Okay, so is that a specific suggestion?
That is my specific suggestion. We start at 1 p.m. tomorrow.
Okay, Councillor Stroud. Sorry, Councillor Stroud, are you still there? I think that's the amendment.
Sorry.
To you.
I'm good with the friendly amendment.
Okay. Okay, colleagues, so we have a friendly amendment on the floor that's been accepted. So the new proposed time would be 1 o'clock tomorrow.
Mayor Scott, can I please clarify the motion as what I understand it to be, just to make it a little simpler for everyone to understand? So tomorrow we have a regular council meeting scheduled for 4 o'clock. Should you choose to defer this matter to 1 o'clock tomorrow, essentially what we're doing is calling a special meeting for 1 o'clock tomorrow just to conclude the mandatory mask issue. We'll roll into the regularly scheduled meeting following conclusion of this matter.
Chief, could we not just adjourn until 1 p.m. tomorrow? Sorry to ask the procedural questions. I believe that's how we do it during budget.
Yes, you absolutely can still do that. It's a continuation of today's meeting, though. It's not starting tomorrow's meeting at 1 o'clock.
So then I will change my friendly amendment to say that we adjourn today's meeting until Tuesday at 1 p.m. for a continuation of this agenda.
Okay, Councillor Stroud, do you accept that? That's a further modification of your motion.
Yes, I'm good with the friendly amendment.
Okay, colleagues, so I think we should just take it to a vote. The only concern I have is that the public's not going to be able to see the debate, which is, well, at least many members of the public, although the urgency is addressed. So I'll throw that out there. But why don't we just go one by one through the list and people can vote or make a comment at the same time. Councillor Balson? So tomorrow at 1 p.m.?
Yes.
Okay, Councillor Engels?
Yes, I'm good with that.
Councillor Lalonde?
Yeah, I'm good with that.
Councillor McGrath?
Yes, I'm fine. Might be a few minutes late due to some stuff I got to get done, but for sure.
Councillor Marr?
I can adjust.
Councillor Murphy?
Yeah, I can make that work. I'm wondering if you had an alternative suggestion, though, when you're calling Mayor Scott.
Yeah, I do think it will take about 3 hours is the only problem. I would have been good for the following day at the same time. But the urgency probably should prevail. So, notwithstanding my concern, I'm okay with a majority of people have already indicated that they support it. Councillor Murphy?
Oh, yeah, I'm good.
Councillor Peddle?
That's fine, Mayor Scott.
Councillor Stroud?
I'm good with that, Mayor Scott.
Councillor Voyageur?
I'll try.
Okay, Councillor Allen, I'm pretty sure you're not going to be able to participate, but can you confirm whether you support?
I'm a yes on the adjournment.
Okay, and I think just so the public's aware, my colleague Councillor Allen has surgery tomorrow, so he probably won't be able to participate. So that was carried unanimously.
Mayor Scott, sorry to interject. It's Jade here. We didn't get a vote from Councillor Voyageur. We need a clear yes or no on the record.
Councillor Voyageur?
Sorry, yes.
Thank you.
Okay, colleagues, so that is carried unanimously, and this will be continued at 1 o'clock tomorrow. And Jay, do you still need a motion to close off delegates?
No, we do not.
Because it's a continuation.
It's a continuation of today's meeting. We are hearing all delegates at second reading.
Okay, colleagues, so when we pick it up tomorrow, we will begin with questions of administration and potential amendments. Have a good evening, everyone. Thank you to all those who participated. Take care, everybody. We'll see you at 1 o'clock tomorrow.
Scott, just just have one question.
Oh, yeah.
Will the meeting tomorrow be held electronically for all of us as well?
Jed?
Through the chair, this is council's decision.
I'm okay to meet. Obviously, doing these electronic meetings is very challenging, but if there's feedback, I'd be grateful for it.
They want to go in the chambers. Okay.
Yeah, I never. I wasn't asked. Like I find it like what I'm asking is. So far, I've been directed to where I take my meetings. It's not a council decision. I haven't heard that yet. So I'm just wondering if tomorrow is, in fact, the same way we're doing it right now today. Just a simple question, so I know what to expect.
Why don't we go through the list and get feedback? Councillor Balson?
I was just assuming we were going to continue with this electronic format for tomorrow in the same way, and a link would be sent out for the 1 p.m. meeting. That was where I thought we were heading.
Maybe I should just go to Jade for a moment. Do you have feedback, Jade?
Through the chair, that would be our assumption as well from administration's perspective, that this is a continuation of a virtual meeting under the COVID-19 order in council. The same way the regular meeting for tomorrow was advertised to the public, virtual electronic attendance.
Is there a location we could meet in person if we so chose to do it?
Hi, Mayor. It's Jamie here. I think there would be some logistical concerns if we were to have a meeting in person at 1 o'clock. Would we then leave that space and come back here for 4 o'clock for electronic meeting? I think we'd have to really move quickly to figure out logistics of having everybody in the same room, given it's 11 o'clock now. Barring any comment from Jade, I would look to her from a coordination perspective, but it might be difficult.
Jade?
Mayor Scott.
Do we not need to keep it the same as it was scheduled for this meeting and advertised?
Jade?
Thank you, through the chair. My recommendation would be to keep it the same, which was what was advertised to the public.
Okay, let's just go through the list, see if there's feedback on that issue.